That's a picture of my granddaughter. She's now a good bit bigger than that. But we're going to talk about her skin, talk about her skin. And obviously when folks are younger and skinnier, skin is younger. And skin is really important in our society. All you got to do is look at the ads on TV for Dr. Darm and know, how important the skin is to folks and how much money they're willing to pay to get it changed around a little bit. I don't know. Skin conjures up a lot of thoughts and has been written about and talked about for the ages. When you think skin, what comes to your mind? Protection? Come on. Skin flicks, right? Skin. Yeah, all kinds of stuff. There's skin. There's somebody worshiping the sun for their skin, right? And we certainly spend millions of dollars on that and so forth. Skin defined involves subjects who are nude, expected to conduct skin searches for weapons, especially devoted to showing nudes like skin magazines. The adjective is used in a lot of different ways. Michelangelo was quoted as saying, "What spirit is so empty and blind that it cannot recognize the fact that the foot is more noble than the shoe, and skin is more beautiful than the garment with which it is clothed." Now, I'm an old guy, and I have to tell you that I think Michelangelo is exactly right. And I feel the same way about a lot of these artistic tattoos. I know people love their tattoos, but I would say that I think the skin looked better because that's just my opinion. I have a dream that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. Boy, this country is continuing to fight those same fights over skin color. And I think it's important we all keep thinking about it. Beauty to me, is Gwyneth Paltrow, is about being comfortable in your own skin. That's a statement I hear often. Oh, he's so comfortable in his own skin. Or that kick-ass red lipstick. Go for it, Gwyneth. And Red Fox, he was a comedian, black guy, back in the 60s and 70s. Beauty may be skin deep, but ugly goes clear to the bone. Yeah, maybe so. The skin is used for art, and man, some of it is really amazing these days and beautiful. I think there are folks that take it a little bit too far. And let me just tell you a couple things about that picture right there. First of all, do you notice her eyebrows? They're gone. Eyebrows do protect your eyes from crap falling in them and so forth. You notice her eyelashes? I think they're gone too. Who wants to pluck their eyelashes? That must have been a lot of fun. Oh, and also bald. Yeah, so maybe her head gets cold now too, doesn't it? I'm going to say this is not a chemotherapy patient. Just guessing. Sometimes we think it's not dark enough. Sometimes we think it's too dark. We spend lots of money making it darker. We buy these things. We get tan lines. Is that would you call that a tan line? I would call it a burn line. And then a lot of folks who have darker skin try real hard to make their skin lighter, which, here's skin whitening cream. And the guy that used more of that than half of the world, I'll show you next, I guess it's the next slide. This is the life the young cowboy had dreamed of. Where else could you find people out in the sun with no regard for sunscreen? Yes, this was the Wild West. I have a lot of views about skin and skin protection lotion all the time for kids and everything. I'll give those to you as we get on through this. We worry about our hair. We try to make it grow. People spend billions of dollars on trying to get their hair to grow. They also spend tons of money getting laser hair removal. There's whole offices that are dedicated to only this one thing, hair removal clinics. One thing I've always found amazing is that men in TV and on the movies and everything are now completely shaved. You will not see any actor or actresses, not actresses, but actors that aren't completely shaved. All their underarm hair is gone. All the hair off their chest is gone. They're usually oiled up. I guess that's sexy looking, but I find it amazing. We spend a lot of money on hair implants, comb overs. New scalp exerciser is driven by electricity. Absolutely nothing works, I'll just tell you. None of these treatments work at all. And even the pills that you take to grow your hair, man, I had a bunch of friends when I was in medicine that were worried about going bald, and they started taking that stuff, and all it ever grew was a bunch of little peach fuzz. It did grow some hair, but it wasn't like normal hair. It was like yuck. This is a disease called... Huh?
Or something like that? I don't know.
I'm blocking on it right now. Vitiligo, thank you. This is Mr. Vitiligo right here. Mr. Vitiligo is what he always told people, is that he had this skin condition called vitiligo. But, he was one handsome dude, I thought, early on. And then he started all these skin treatments and so forth. And he kind of looked a little creepy by the end of all of it. I guess I kind of always thought he was creepy anyway. I have a skin disorder that destroys the pigment on my skin. It's something I can't help, okay? Yeah, Michael, you got it, buddy. Skin flicks, skin heads. Christy Brinkley. Gosh, I saw Christy Brinkley on TV the other day, and she looks as good today as she does in this Playboy magazine here. Can you read the date on that? I think it's 1986. Here it is, 1986, yeah. Playboy was only $3 back then. I think she could be in Playboy today and look just fine. What do you think Cindy Crawford would pay for her mole? Or Julia Roberts, I guess. Who is it that has the mole over there? I think that certainly adds to her the value as an actress a lot, and her beauty. My little lesson, my little sermonette here is if you're going to get piercings in your ear, be really careful. Remember what we talked about cartilage the other day? What did I say about cartilage? It doesn't have any blood vessels going through it, right? So if you get an infection in a cartilage, it's a mess. I'll show you slides later. But the entire ear will turn bright red, and the whole cartilage in your whole ear will turn to pus. And the treatment of it is go around in back of the ear and make a really long incision down the back of the ear and drain all the pus out, scrape out all the cartilage, and try to clear the infection up. But I will tell you that you're left with one very ugly ear at the end. So if you're gonna get ear piercings, keep them in your lobe down here. Isn't that enough? I mean, when you start sticking them through the cartilage, every time you do that, you take a serious risk of getting infection. So there's one right there. It's infected. There is no treatment for that other than take the bone out, or whatever you call those things, and it's going to require lots of antibiotics and an incision down the back to drain the pus out. That's not a good deal. Okay. Introduction to the integumentary system. Integumentary. Can you spell that one?
Yeah.
All right, it's the largest system in the body. It's about 16% of your weight. You don't have to memorize that. About 2 meters squared in area. So if you're going to make lampshades out of human skin, you can use that as an estimate of how many bodies you're going to need in order to make a big lampshade. That's a disgusting thing. Integument is made up of 2 parts, the cutaneous membranes, which is the skin, and the accessory structures. The accessory structures are the fingernails, the toenails, the hair. The cutaneous membrane has 2 parts. Now, the cutaneous membrane is really the skin, but it's also, it includes the lower levels called the dermis. So, the outer is the epidermis. Remember, we studied epidermis when we were studying epithelium. And remember that it's the superficial, it doesn't have any blood vessels in it, it's only from the basement membrane and out. But as we study the skin, we're also going to study the inner dermis, which is all the connective tissues. Some of them are loose, areolar, some of them have a lot of elastic fibers and a lot of collagen fibers that are in the dermis that support the skin. The accessory structures that I just mentioned, they all start in the dermis, extend to the outside, and they would include your hair, hair follicles, your nails, and many of these multicellular exocrine glands. Now, go look at those words and think about it. Multicellular means a bunch of cells. It's not; these aren't mucus, just those goblet cells every so often. They're multicellular, and they're exocrine. What does exocrine mean? What? They secrete. They don't use a duct. No, they do use a duct. Exocrine glands all excrete through a duct. Endocrine glands secrete straight out into the tissues around it. The subcutaneous layer, oftentimes referred to sort of as the fat layer, but it's a superficial fascia, actually. If you go back to that thing about different layers of fascias that we talked about in the last chapter, you know that it's below the dermis. It's where you would give somebody a hypodermic injection. Hypo means below the dermis. Now, the dermis and the epidermis together are both very thin. Very thin. Okay, this is the one slide this is the only thing you need to know. Don't ever say that, Sessions. This is a lot of what you need to know right here. So here's what the skin looks like down to the hypodermis down in here. You see also referred to here as the subcutaneous layer. Hypodermis. Notice that the big blood vessels kind of run through down here in the hypodermis, so they're not right up here in the superficial. There are no blood vessels above the basement membrane, and the basement membrane is this line right here. It goes right there between the pink and the blue. That's where the basement membrane is. So everything above that line right there is the epidermis. Those are the skin cells, basically. And then everything below that is the dermis and the hypodermis. Those are all just to support the surface. Okay? We divide the dermis into 2 layers. We divide it into a papillary layer. Now, papillary layer, what does that mean? What's a papilla? It's a little sticky-uppy thing. Yeah, it's the area that's above the bottom of the curves of the epidermis. So from there up, the parts of the dermis that are below the basement membrane are the papillary dermis. Basically, papillary just means it goes up and down. It has papillae that stick out into the skin. And that'll become important here in a little bit when we talk about fingerprints. Okay? Below that is the reticular area. Now, I think this is a very deceiving name for it, reticular, because this is not reticular tissue.
Remember, reticular tissue is things like liver and lymph nodes and spleen, and they have all those reticular fibers in it. Well, this is kind of different. This is just called reticular because it's got a whole bunch of fibers going in lots of directions. And basically, you see a lot of collagen in here. You'll see a fair amount of elastic tissues in here because, you know, your skin is stretchy and it does return itself to normal. Other than those things, there's a series of receptors that allow us to feel and receive input from the outside. And some of them are, this one here, a lamellated corpuscle. We'll go through these one by one. Allows us to feel pressure. Tactile corpuscles up here allow us to feel touch. We have a lot of just naked nerve fibers like these here. They're just nerve endings that we also feel with. There's a couple more. Here's another one right here called the root hair plexus, the hair root plexus. There's a bunch of nerves around the base of every one of your hairs, and that's why we can feel. Just move a couple of hairs and you can feel it. Very sensitive. My sister used to pull my hair, and I can tell you it was very sensitive. This is an example of a hair follicle right here. Please notice that the epidermis, which is normally right up here above the basement membrane, extends all the way down into the nerve root. The hair root. So this is epidermis. These are skin cells that come all the way down to the bottom of that. Notice that off the side of every hair follicle are two things. One is this muscle, which is called the arrector pili muscle. Arrector pili muscle. It's not erector. The hair is not going to get an erection. It's going to have it's an arrector pili. But the fact of the matter is that when these muscles contract, it does make our hair stand up on end. And I have a cat, and the cat, lays around in the house and doesn't do much all day. But once in a while, she goes out on the back porch, and especially in the winter, she'll be sitting out on the back porch, and you'll look at her, and she's like twice as big looking as normal because she's a little bit chilly. And what she does is she stands all of her hairs up on end, and that creates this huge area of insulation. The air is trapped down in between those hairs, and that acts as insulation. So not only does it insulate her, but it also makes her look bigger. And so if there was a Chihuahua coming after her, the Chihuahua would probably turn and run. And then that's actually a defense mechanism for all animals. And you've seen them rear up the hair on the back of their back. They do that to look bigger, so that hopefully their predator will take a hike. Notice that also attached to every hair follicle is a sebaceous gland. It's basically an oil gland. It's the skin oil gland. And I think I already mentioned the issue with shampoo and how you all pay lots of money for shampoo to get all that oil out of your hair. And then you go out and put conditioner on it to put all the oil back in it. And you can avoid that completely by just using a bar of soap, like me. I think I've gone over everything. Here's a little cutaneous plexus. That just means there's blood down here. And obviously, if these blood vessels get all filled up with blood, then your skin looks redder. And if they're all empty, like if it's cold outside, then your hands will look white. I've got really vascular hands, and I can go white, red. It just takes a couple seconds for the blood vessels to fill back up with blood. Okay, so what are the functions of the skin? You probably better know these pretty well. It's basically there to protect us. It's also there to excrete stuff. We actually excrete some wastes out through our skin. We also excrete water, and we excrete a lot of salt. And if you've ever been outside sweating in the summer and taken a look at your arm, you know it's pretty salty. And that's one of the ways our body gets rid of extra salt. We know that our skin plays a very important role in body temperature. Not only does it insulate us, especially if we've got some fat under it, but it also sweats and has sweat glands in there that will help us get rid of heat. When the sweat evaporates, it releases a lot of heat. It feels really cool, and also actually cools us down. This is kind of an odd one. Your skin actually makes vitamin D, D3. That's why you need to spend some time out in the sun from time to time. And if you don't, you can get low on vitamin D. There's been a big push by the pharmacy companies for everybody to take a bunch of extra vitamin D. Why? What? Why do they?
Caution? Because we're low on it.
No, not really. Why do they always advertise for us to take more vitamin D? Well, of course they want money. That's why they do everything. But calcium, that's right. Vitamin D works in your intestine to make your intestine absorb more of the calcium that you take in. So if you don't have vitamin D, you can't absorb all the vitamin. If you don't have vitamin D, you can't absorb all the calcium you even have. And this used to lead to a disease called rickets in kids. It was really common here, even in the United States. If they didn't spend any time out in the sun and they didn't get any vitamin D, they would get rickets, they get bow legs, and I'll show you pictures here in a few minutes. But that's a vitamin D deficiency. How did we fix it? There's probably some small government people in the crowd here that believe that the government can't fix anything, but I can tell you this is one of the dozens and dozens of diseases that have been completely eradicated by government intervention.
They started fortifying milk.
Milk in America is fortified with vitamin D. You can't hardly buy a bottle of milk that doesn't have vitamin D, and it has completely eliminated this disorder. Your skin also stores fat. It's a good energy source. It's also a good insulator. And also, it plays a really important role in sensation. We touch with our skin, we feel pressure, pain, heat, and so forth with our skin. Okay. So the epidermis. The epidermis is that very top part. Remember, the epidermis is above the basement membrane, above the basal lamina. It is avascular up there, and so it doesn't bleed. Well, most of the time when you cut yourself, it does bleed, but if you cut yourself really finely, like a paper cut a lot of times, it's just through the stratified squames. It hurts like hell because there's lots of nerve endings up there, but there aren't any blood vessels, so it doesn't bleed. So where do all those skin cells get their oxygen and get rid of waste and so forth? Well, that all happens by just pure diffusion from the dermis, especially from those papillae that are sticking up into it. The oxygen diffuses out of the capillaries and gets to those cells. This is kind of how it looks. If you could peel it off, you really can't do this, but if you could, it would work like this. And you notice that there's a bunch of these dermal papillae, they're called, that stick up into the skin to increase the amount of surface so that there's more area for the oxygen to diffuse from down here into these cells up here. Okay? So there's the epidermis. This is the basement membrane, or the basal lamina would be that black line along the edge of it. Let's talk about the cells in the epidermis, the top part of our skin, because that's kind of what you think of as the skin, at least it's that very top part up there. And the cells that are up there, we call them keratinocytes. Keratinocytes. Now, what does that mean? Keratin is a protein, and it's a protein that's kind of leathery and dry. It makes the cells, when they get all full of keratin, they're very dry and leathery. That's what we're feeling when we feel our skin. These are by far and away the most common cells. There's a few other ones we'll talk about, but believe me, keratinocytes are probably 98% of all the cells that are up in the skin. We have two kinds of skin we talk about. One is called thin skin, and the other one is called thick skin. And it doesn't take a rocket scientist to look at your hand or look at the bottom of your foot and realize that the skin there is thicker. And because it's thicker, it has an extra layer of keratinocytes. So there's 4 layers of keratinocytes up here that we're going to learn about, and there's 5 layers of keratinocytes down here that we're going to think about. But let me tell you, this little extra layer, which is called the stratum lucidum, we'll get to it in a few minutes, is really thin. It's not the one that makes thick skin thick. The thing that makes thick skin thick is that cornified layer on top. It's all hard and leathery, and it can be very, very thick in thick skin. So here we go. This is kind of what it looks like. And let me just kind of use this as kind of an introductory slide. This is the dermis down here. You notice there are collagen fibers running all through it. I don't really see elastic fibers in there, but there are. They're just not stained for. These are blood vessels running through here. This is the basal lamina, and from there up, it's the different layers of keratinocytes. Notice that in thin skin, as illustrated on this side, that stratum corneum level is very thin. Look over here, in this thick skin on this side, you notice that the stratum corneum is very, very thick, okay? But remember, this is the layer, the thick skin has that extra layer, and that extra layer is this little whitish layer right along here, lucidum, lucid. It's almost clear, but not quite. That's it. We'll go through the different layers in just a minute. Okay, so let's go through the 5 layers of keratinocytes in thick skin. And we generally talk about them from the bottom to the top, because the bottom, down by the basement membrane, is where they are formed. And they gradually, as they're formed and they mature, they work their way up to the surface, and then they fall off. Okay? The basement layer, the lowest level, is called the stratum germinativum. Well, why would you think it might be called that? They germinate, right? It's germinating a bunch of new cells, okay? So this is where all the new cells are germinating, and we also call it the stratum basale, the basal layer. 2 words mean exactly the same thing. The next layer up is called the stratum spinosum. Now, I know these are kind of Latin words, but they're really pretty easy. You could just call this the spiny layer, the stratum spinosum, and the cells look kind of spiny. I'll show you that in a minute. The stratum granulosum, they've got granularity to them. There's little dots in them of stuff. Then there's that stratum lucidum, that semi-clear layer that's very thin but is extra in the thick skin. This is not found in thin skin. Then there's the stratum corneum, which is the top layer, the corny layer, the cornified layer, the one that's real thick and flaky. Now, I think your book came up with this. I couldn't remember that in a million years. Cora Lucille's granny spins baseballs. Or CLGS. They use baseball for basale. Anyway, you need to know what order they come in. Yeah.
Is granulated tissue the same thing as the stratum granulosum?
Is granulation tissue? No. Granulation tissue is like new flesh. It's mostly just keratinocytes. A lot of it is just connective tissue cells, and it's trying to fill in the hole of something. A lot of granulation tissue is actually bacteria.
So when you get calluses, are you just building up extra cornea?
Yes, yes. Calluses are your corneum level. So here's a better microscope picture. I think this one's pretty good. So this area down here is the dermis, and you would say this area is the papillary dermis down underneath there. Here's the basement membrane right here, and notice that the cells that are right above that are called the stratum germinativum, or the stratum basale. And notice that they are anything but stratified squamous. They're very cuboidal. There's lots of mitosis. Usually, if you look, here's a mitosis right there. Anyway, a lot of times when you look under your microscope, you'll see a fair number of cells that are, in metaphase, that are pulling their chromosomes apart, because these cells are duplicating very quickly, making lots of new cells, because they have to push up, and we are constantly sloughing our skin off all the time. I haven't taken a bath in a long time, but every time I take a bath, the reason I kind of get the yucks from it is that there's this ring around the tub when you get out of it. What do you think that is? It's nothing but dead skin cells. So it's these cornified layers up here that just flake off every time you get in the water. Some of it flakes off. Let's work our way on. So here, if that was the basal layer right there, this next one is germinativum. I'm sorry. Next one is spinosum. They're spiny looking, and there's better pictures of this, but you just, maybe on this diagram, you kind of have to take my word for it. The next one is the granulosum. You see it's got the dark spots in it right here, the granuli. The next one is the stratum lucidum. I think this is a very poor illustration, but it's this clearish line right across here, and then from there up it's the stratum corneum. And even in the stratum corneum, you notice that the cells are still not very squamous, and it's really only by the time they get to the very top that they really sort of look like thin squamous cells. Going through them again here, germinativum, the bottom layer, lots of stem cells called germinative cells. They are basal cells, same thing. They're attached. There's a pretty thick bond between the epidermis and the dermis. The epidermal ridges or fingerprints are formed in the germinativum layer down in the bottom, because remember, it's the one that follows the papillary dermis below it. These little mounds, they're there just to increase the surface area of basal lamina, which allows the diffusion of things up to all of these cells. So see, here's the blood vessels down here in the dermis. The only way that your skin out here is alive is that from here to there, it diffuses. Things diffuse through all of those cells to get out there. So that's how oxygen gets to your skin and so forth. Here's an example, a close-up of fingerprints. You notice that the skin on your fingers has these papillae, and the papillae underneath lead to these sweat glands. We haven't talked about sweat glands, but your sweat glands are following the ridges, and that's why when you touch something, you leave a fingerprint, and what you're really leaving is a print of the oily sweat from your finger on something clear, I guess. So these are the epidermal ridges. Can you file your epidermal ridges off? Not really. Hurts like hell if you do, because you can't just, you got to get all the way down to the deepest layers, because your fingerprints really come from the deepest layers. Keep that in mind. You want to be a crook. Or gloves. cell, in the stratum germinativum, there's several kinds of cells. Merkel cells, they respond to touch. There's also melanocytes. Melanocytes make a protein called melanin, and melanin is then found, these cells are found scattered throughout the stratum germinativum, so through the very bottom. And this right here is the only difference between the races, is the melanocytes and how many of them there are. It's not even so much how many there are, it's how much melanin do they make. So people with one genetic background may make lots of melanin. Another group may have just as many melanocytes, but they don't make very much melanin. Their skin tends to be lighter. What does melanin do for us? It protects us from the sun. It protects us from ultraviolet rays. That's a test question. The spiny layer is the next one up. It's it's the next one up. It has 8 to 10 layers of keratinocytes. The reason they look spiny is because the cells are shrinking at this point. And as they shrink, you start to be able to visualize the cytoskeleton. I think you'll see some other pictures, maybe in your book or your lab book, that illustrate that a little better than the slides I've showed you here do. But they do continue to divide a little bit, which makes the epithelium thicker. And here's another test question. Within the stratum spinosum are these specialized cells called dendritic cells. Let's call them dendritic cells, not call them Langerhans cells. That's an eponym, right? Now, whenever I say the word dendritic, you probably think dendrites. You probably think nerve cells. You probably think nervous system, and so forth. But that is not right. The dendritic cells are immune cells. They are the cells that allow us to have the flu once and never get that particular strain of the flu ever again. Okay? So these are really kind of the memory cells in your immune system. I'll show you a movie when we get to the immune system. That's in 232 that will explain that to you clearly. But just remember, the dendritic cells play a major role in our immune response. Next layer up is the stratum granulosum. It starts to look grainy and granular. The cells quit dividing up at this level, and they just start making keratin and keratohyalin. These are proteins that are found in the skin. They're going to make it tougher, make it drier, make it more leathery. Stratum lucidum, the clear layer. Like I said earlier, it's only found in the thick skin, even though it's just a tiny layer. I think this is silly. I don't even know why we mentioned that, to be honest with you. The stratum corneum is the horny layer. It's 15 to 30 layers of keratinized cells. They are very water resistant, and they are constantly shed and replaced about every 2 weeks. So you're getting a new set of skin about every 2 weeks. Now, we say that the skin is water resistant, but it's not completely water resistant. And the reason you know that is if you get in the hot tub and you stay there for 45 minutes or an hour, what happens to your hands? They get all wrinkly, right? Puffy looking. Why is that? Why does that happen?
Evolution to grip.
No.
Because of osmosis.
Osmosis is the answer. Now, but explain more to that. What do you mean it's osmosis?
Because of the salt level in our body, and there's no salt in the water that we're living in, we absorb, the water goes out from our body to the bathroom.
Goes out? In. Right. Okay. Hot tub water is basically pure water. There's a little bit of chlorine in it usually, but not much. It's very close to pure water. And so the concentration of the water molecules is much more concentrated on the outside of our skin than it is on the inside, because on the inside has lots of salts and lots of proteins, lots of sodium, all that stuff. And it wants more water to come in by osmosis. And so that's what happens in the hot tub. Now, those 33 guys that were on that ship down in the Bahamas this weekend that sunk.
Did they find them?
No. They found one body and one torn up life raft. That's it. Anyway, you think they got all swollen up from being in the water? Huh? Huh? No. Why? What's the difference? It's salt water. That's right. It's ocean water. And so ocean water is more concentrated, the salt is more concentrated on the outside than it is on the inside of their skin within their body. So the water tends to go out. So if you had a salt water hot tub, your fingers wouldn't swell up. Okay? You'd have salt all over. You might itch a little bit. You'd have to hose off at the end, but your fingers wouldn't swell up. Okay? And a lot of swimming pools and hot tubs are going to salt water. They're what?
It's like a mixture, it's like half and half.
Yeah.
It's usually like, I think they put chlorine in or something like that. It's not actual salt water.
It's not salt. I think it is. There's a lot of salt in it.
It is,
Bromine is like chlorine. A lot of facilities use bromine instead of chlorine. I think it's cheaper. I'm not sure, but it does the same thing as chlorine. It kills the bacteria and so forth. But it's the salt. I was a member of 24-Hour Fitness, and they had a salt water lap pool, and it was salty.
It's usually half and half.
Okay.
Half and half.
All right. I can buy that. So anyway, that's so now we'll go on. So keratinization is a term that means just the cells are getting filled up with this keratin. It occurs everywhere on your whole body except for in your eyes. Your eyes, the covering over your eyes is called your conjunctiva. You've heard people having conjunctivitis. The cells they don't have keratin in your eye. Make it hard to see through. You got all that thick protein in it. The life cycle takes about 15 to 30 days. What's that? About a month, 4 weeks or so, for a cell to move all the way from the bottom, from the stratum germinativum where it's made, to the stratum corneum where it falls off. Let's talk for a couple minutes about sweat or perspiration. And let me just say that insensible perspiration is simply water that goes right out through your skin cells. And by the same token, the reverse of this would be the swollen fingers that we talked about when you're in fresh water. Okay, in the hot tub, your fingers get swollen. Because that's water that goes directly through the skin cells. Insensible perspiration, call it insensible because you really don't even know that it's happening, but it's happening all the time. We are all sitting here sweating a little bit all the time. Why? Because there's more water inside of our skin cells than there is out here in the air. Right? So osmosis is going on as we all sit here, and water is evaporating right through our skin cells to the outside. Now we call it insensible because it's not like it's dripping off of us. It's coming out very, very slow and evaporating. It's a small amount. I want to say we calculated it about 300 cc's a day. But still, that's 300 cc's. That's pretty good. Can I borrow your bottle there a minute? How many cc's is this? This is 600 cc's. A quart, which is 32 fluid ounces, is 1,000 cc's, and it's a little bit bigger than this. You've seen 1 liter bottles, and you've also seen the big 2 liter bottles. So we're losing maybe about half of this amount of water every day just through insensible perspiration. Now, sensible perspiration is what you recognize as sweat that occurs when you exercise or when it's really hot, and that is water that's actually excreted by the sweat glands. We haven't talked about the sweat glands yet, but we're gonna. The thing about sweating is that you can actually sweat as much as 5 liters an hour, 5 quarts an hour. So if you've ever worked as a first aid station at a marathon, and it turned out to be a really hot day, you have dozens and dozens of runners coming in that are dehydrated because there's no way you can run a race and drink 5 liters an hour. I mean, you just can't drink that much. So they're going to get dehydrated, and hopefully it doesn't take them 7 hours to finish the race because they'll really be dehydrated if they've been out there that long. And of course, it depends on the humidity and depends on the heat and so forth. But sweating is a big deal. And it's the water you can actually see on the surface of your skin when it comes out of the sweat glands. So it's sensible. That doesn't mean it's any smarter. It's sensible. Oh, it's such sensible perspiration. Dehydration results from damage to the stratum corneum. The worst injury I think humans can ever undergo is a burn, a big burn where they lose a bunch of their skin. Because when you don't have the skin to hold your fluids in, huge amounts of fluid come out. We used to get people in the emergency room that were burned on 80% of their body, and we would do the calculations, and we would be giving them 7 liters an hour. 7 liters an hour, because that's how much is weeping out through their skin and how much is evaporating off. So it's big time. Dehydration can result from any burn, but if it's a significant percentage burn, it's huge. Immersion in hypertonic solution. This is what happened to those guys that fell into the seawater. They all got dehydrated because, remember, the salt water is more salty than they are, so the water goes out of your body and out into the ocean. This is also a good reason if you're drowning or if you're on a lifeboat or something, don't drink salt water. If you drink salt water, it'll kill you faster than if you didn't drink anything, because that salt water will make your body pour more water out into your stomach and so forth, because that's what osmosis does, right? It's where water always goes from the area where the water is more concentrated to the area where the water is less concentrated. Hydration. You can get overhydrated by soaking up too much water, like the fingers we talked about in the hot tub. And it usually is most evident on the palms and the soles. Let's talk about color of the skin. Color is affected by several things. One is carotene, and you can think of carotene as carrots. That's a simple way to remember it, I think. Carrots are what make you make vitamin A, and vitamin A helps with your eyesight. Your mother used to always say, "Eat your carrots. It's good for your eyes," and she was actually right. When we get to the retina and study the way we see, you'll see that many of the products that make up vitamin A are what actually causes the reactions that occur in your eye to make vision happen. Melanin is this brown or black pigment. It's produced by melanocytes. They start off down deep. There are melanosomes, or little packets of melanin that travel from the melanocytes where they're made into the other keratinocytes. Okay, remember, there's just a few melanocytes. That's where the melanin is made. It's packaged up into melanosomes, and passed out to the other keratinocytes to make the skin color what it is. The other thing that changes skin color is your blood circulation. I think I've made that clear enough by now. If you got a lot of blood circulating through your hands, they look pink, red. If not, they look kind of pale. We'll talk about that a little more. So here's an example of skin. It's not thick skin, it's thin skin, obviously, or at least it would appear to be that. We don't know how far up here this extends. But here's a few melanocytes along in here, one there, and maybe another one here. They're full of melanin. The melanin is packaged up in these little melanosomes, and then you can see the little packets of melanin out in these other cells, here, so forth. That's what makes the skin dark. This is a drawing of it. Here's one melanocyte right here, and it makes all the melanin, packages it up into these little melanosomes, and then those melanosomes are then passed off into these other keratinocytes, skin cells, to make the skin darker. Skin cancers, everybody freaks out about skin cancer. First of all, let me say that about 99% of all skin cancers are not this kind right here. Melanoma is the bad one. Melanoma is a bad actor. You don't want to have melanoma. Melanoma will spread and kill you. Basal cell carcinomas, squamous cell carcinomas are 50 times more common than melanoma. The thing about these, they are called cancers, but they almost never metastasize. They never spread. So even though they may live there on your forehead and get bigger and bigger and bigger, they very seldom will spread around your body, go to your brain, go to your bones, and kill you. Okay? You know, I used to take off 2 or 3 of these every week. And it's like no big deal. You take them off, you send them to the lab, and the guy says, well, yeah, it was a skin cancer. You'd say, thank you very much. And you tell the patient, listen, just keep an eye on that area and the place where your incision is, where we took that off, just keep an eye on it. If it ever gets kind of raw, or if you see another spot that looks like the first one, come back, we'll re-excise it. But it's not going to kill you. Basal cell carcinomas and squamous cell carcinomas are both related to sun damage. No question about that. There's a big debate in the scientific world about whether melanoma is really caused by sun exposure or not. Now, the reason I tell you that is because they do these analysis, and they take 100,000 people with melanoma, and they say, well, where was your melanoma when it started? And they find that there's lots of them that are on the bottom of your feet, under your armpit, in your groin, around your bottom. Those areas don't get much sun, so it's kind of hard to understand why, because if it was truly caused by sun, wouldn't it almost always occur in parts of your body that were exposed to the sunlight? Your hands, your truck driver's arms, your face, and so forth. But it doesn't work that way. Melanomas are generally found scattered completely all over your body. So I have a hard time with that, and a lot of people do. Not that melanoma is a bad actor, though. So what are the functions of these melanocytes? Well, they make you darker. They also protect you from sun damage, which is basically protecting you from ultraviolet radiation. And you know that people that are very light-skinned and don't have hardly any melanocytes, they burn like crazy. I had red-haired friends that can't go out in the sun but for 5 minutes, and they're burning. And I thought, what a bummer. What a bummer. But anyway, that's really the function of melanin. And this point is the point I already made. Skin color depends on how much those melanocytes make, how much they produce, not how many melanocytes you actually have. Oxygenated blood, I think we beat that to death. But just know that, know this term, cyanosis. Cyanosis is when your skin kind of turns blue, and that's caused by either a severe reduction of blood flow or a lack of oxygenation. You know, when we breathe in oxygen and our hemoglobin, as the blood passes through our lungs, it picks up oxygen and it becomes bright red arterial blood at that point. And then it goes out to the tissues and it comes back through the veins. And the veins, the blood is really dark blue, almost purple in the veins. And then it goes back to the lungs again and gets bright red again. Okay? Well, if there's something wrong with you, for example, your lungs aren't working right, your heart's not sending enough blood to your lungs, your blood will all turn purple, and that's what really causes cyanosis. So some babies that are born with holes in their heart that routes the blood the wrong way, they're blue babies. They're also the old guy, the old smoker who doesn't have any lung function yet, doesn't have any left. He may have purple lips and purple fingertips and so forth because he just doesn't have enough oxygen in his blood to keep it bright red. Other skin color things, the jaundice. Jaundice is a buildup of bile from your liver. It makes your skin turn yellow. Hepatitis will make you turn yellow. Addison's disease is the disease that John F. Kennedy was thought to have. It's basically a disease of the pituitary that leads to skin darkening. And vitiligo is that splotchy loss of color that I talked about with Michael Jackson. Vitamin D3 is the one that needs the presence of UV radiation in order to produce cholecalciferol, vitamin D3, and then it travels through your blood, goes to your liver and kidneys, where the D3 is converted into calcitriol. And we'll study calcitriol a lot when we get to studying the bones and when we get to study the endocrine system. It helps us absorb the calcium and phosphorus out of our GI tract. And insufficient D3 can cause rickets. Here's an example of a kid with rickets. This is just from lack of D3. And it's been pretty well completely eliminated by fortifying milk in America with vitamin D. Okay, why don't we stop there with dermis? We'll go down through the deeper layers next. Now, we've got, when's our exam? Next Thursday. So we have 2 more days. We have this Thursday and next Tuesday. I will probably finish the skin this Thursday, so then we'll have an extra day. Well, we're not going to stop. We're going to keep rolling. So we will go right in to start to study the bone. That's the next chapter. We may have half of the hour or all of the hour to study that. It won't be covered on the test, but we will do it, just as we can't manufacture days at the end of the term. Make sense? Okay. I used your paper. That's your paper, right? I just wrote all the misspelled words that other students spelled wrong. So I could write them on the board up here. That's what all that writing's about on your paper. It's not because of you. No problem. I figured you didn't do it on purpose.
Yeah, okay. Just like a little bit, and then just like okay, give it better, and the same.
Okay, so here's the second part of the chapter on the skin. I hope we'll get finished with it today. I can't promise that, but we have Tuesday because our exam is not till next Thursday anyway, so we'll be okay. Skin, we talked a lot about it yesterday, and like I said, we'll go into the histology a little bit more, and hopefully this will all make pretty good sense to you. The dermis. The dermis is found between the epidermis and the subcutaneous layer. The subcutaneous, just think of as the fat. It's kind of deep down. Remember, the epidermis is just that avascular part that's above the basal lamina, and below that is where all the action really happens. And it serves as an anchor for the hair follicles, the sweat glands, and so we'll need to look at all of those, and you should be able to identify all of those under the microscope. Basically, the dermis is divided into an outer papillary layer and an inner reticular layer, and that's not working well. Here we go. So the papillary layer is just the part that's in the papillae. So if you could draw the basement membrane like this, then all this out here is the epidermis, and everything below that is the dermis. And if you were going to divide this, you would call this much of the dermis from here down to here the papillary layer, and then below that is the reticular layer. As I think I told you this the other day, the reticular layer, don't get confused by the name. It doesn't have a lot of reticular fibers in it, like reticular tissue. Anyway, there's a lot of collagen and elastic fibers in it, and it contains a fair amount of just connective tissue proper. Remember the crinkly stuff, the loose areolar tissue is another name for it. Dermatitis is a fancy name which just means the redness of the skin. It can be caused by anything. It's a very non-specific title. My dermatology experience consisted of 2 days visit to the dermatology lab with this really smart dermatologist, and we had about 100 patients to see, and they literally had them just kind of lined up in the hallway, and we would look at their rashes, and he would say, "Yep, that's a dermatitis. That's a this. That's a this. That's a that." And I remember his advice was, he said, most of the dermatitises we don't really know how to treat. So the way I treat them is, if they're wet, if they're moist looking, treat them with something that dries it up, like calamine lotion. If it's dry, treat them with something to moisten them, like oil or oily stuff or something. And he said, then have them come back in 5 to 7 days, and most all of them will be completely cured. If they aren't, then treat them with steroid cream. And I thought, wow, that's a pretty simple field. Maybe I ought to go into that. But just looking at kids with acne all day long would be more than I could probably tolerate. So I went into something else. But anyway, that's dermatitis. The strength of the dermis that's really where the strength of your skin comes from, is from the dermis, mostly because of the collagen fibers and the elastic fibers. Skin turgor is a term you need to understand. It deals with the resilience of the skin. And an example of really high skin turgor would be the patient with edema. And I know every day when I would make rounds on my surgical patients, many of whom were vascular patients, I would always kind of grab them I would pull the covers off their feet, look at their feet, and then put my hands on their feet in order to feel their pulses. Obviously, if you fix their aorta or something up here, you want to know that their pulse to their foot's good. So I'd sit there with my feeling their pulse, and then when I got finished with that, while I was chatting with the patient, then I would let go and see if the skin snapped back to normal. And if you still had a fingerprint there from where you pushed on the skin, that's a sign of edema. I think I have some pictures to show you a little later. They have too much fluid, so then we might go out and lower the amount of IV fluids, give them some Lasix, get rid of the extra water, get rid of the extra salt. But you can tell a lot by the state of hydration of the patient just by looking at the skin turgor. Little ladies will have really lousy skin turgor because their elastic tissues and collagen fibers are pretty much gone. And you take a little old lady, take her skin like that, it's probably just going to kind of stay there. And maybe gradually over the next minute or so, it'll kind of flatten back out, come back to shape. But if you're young and vigorous like me, you see it just snaps back instantly. Lines of cleavage. This is not what you guys think it is. It's really kind of boring, actually. The dermis is organized in patterns so that most of the collagen and elastic fibers are arranged in bundles. And the lines of cleavage establish important patterns. Now, these are only important for plastic surgeons, in my opinion. Because anytime you can, what you want to do is anytime you can, you want to make an incision in the lines of cleavage. Because if you do, they will heal back together. There's not a lot of tension pulling them apart. Okay? But if you make it across the lines of cleavage, then it will tend to pull apart, and that gives you a much worse scar in general. Here's what they look like. You certainly don't have to learn this. Just know that you want to make, you hope incisions are in the line of cleavage because they'll heal better. They don't have the tension pulling them apart. So if this is the anterior side of the patient, it looks like if you made most of your incisions in the abdomen transversely, they would heal better. And we know that's true. We used to make all incisions. Every abdominal incision pretty much was made right up and down the middle. And the excuse we made for that was, well, incisions heal from side to side. They don't heal from end to end. And so it doesn't matter how long you make them. But then we found out that if you made the incisions crosswise, not only did they heal better, but they healed with less scar. And that's right here because you see that is in the line of cleavage, more or less, the transverse incisions. So that's the only point to make here. Okay. The reason this is important is, in a plastic surgery textbook, a guy doing facelifts would always, make the incisions way out here, not only to hide it in the hair, but also to put them in the lines of cleavage so the scars would heal better. Enough said about that. The blood supply is out there in the dermis. Cutaneous plexus is a bunch of vessels. The papillary plexus are just the ones that go up into the little papillae. That's all there is to that. Venous plexuses are obviously going to return the blood. And a contusion is black and blue. If you've ever had a black eye or a big bruise, that's called a contusion. And that means that when you were hit or thumped yourself or whatever, you broke some blood vessels under the skin. They bled under the skin into this dermis, and it gets black and blue. Black eye would be a perfect example. It takes about 2 drops of blood under your skin to give you a black eye. And, a lot of times the blood under the skin always tends to go to the lowest level, and there would be times when you'd have a patient that had incision in their tummy up here, and a few days later, you'd see a little bruising around it, and then as time went by, it would actually go down their leg. It's right under the skin, but it still kind of follows gravity and can go down. So the areas below that will oftentimes turn black and blue and yellow and green, and then finally heal back to normal. That's what a contusion is. So here's the dermal circulation that it talks about, and please just know that the ones that go up in the papillae, like these guys, are papillary plexus, and these deeper guys here are really the ones that really bring most of the blood to the skin. This is that reticular layer in here. It's just got all kinds of fibers in it, like we talked about.
The cutaneous plexus brings blood to...
It's part of the cutaneous plexus, yes. I would say these are all part of the cutaneous plexus. Cutaneous means skin, surface. Okay. Innervation of the skin is obviously that's what we feel with, is the nerve endings that are in our fingers that allow us to feel things, and nerve endings all over our body actually. But there's also nerve fibers that go to the skin in order to control other functions, such as the blood flow. There's a nerve going to every little artery that causes that artery to either open up or to close down, depending on how much blood your body thinks you need in that part of your skin. So there's nerves that are going to the blood vessels. There are nerves that are going to the glands. They make you sweat or not. So they have nerves going to them too. And then there's obviously sensory receptors, and we have different kinds of sensory receptors. We'll take a quick look at them here. The tactile discs are called Merkel cells. You should see some Merkel cells under the microscope over in the lab. I know we have good examples of those. There's several others that we have that I think we come back to here in a minute. So the subcutaneous layer is down below that. It stabilizes the skin to some degree. It's mostly just a real or an adipose tissue. That's what allows you to be able to do this. It allows your skin to kind of float over the layers underneath it. It's attached, but yet it's kind of loosely attached. If you were going to scalp somebody, like back in the old days in the West, this is the layer you would want to get down to, right above the subcutaneous layer, and pull the entire dermis and epidermis off, along with all the hair, which makes it a real prize for the guys that did that. Scalping did not necessarily kill the patient, by the way. Usually it did, because when you cut your scalp, you bleed a lot, but it didn't necessarily kill them. They were pretty bald after that. I can't even imagine. Anyway. The subcutaneous layer, the fat anywhere, has very few capillaries. It has no very vital organs. It's where you give sub-Q injections using hypodermic needles. Hypo means below the dermis, obviously. And so it's the deeper layers. When I was doing surgery, we used to do a lot of, not a lot, but I probably did 100 obesity operations. Incisions back in the day before laparoscopic surgery, when we were actually making incisions. We would make an incision through the skin, just go barely through the skin, and then buzz all the little tiny bleeders that are right in the skin. And then literally one of us on one side and one of us on the other would just take the skin and just rip it apart. And by doing that, it would keep us exactly in the midline. We would never get off to one side or the other, it would just go right down the middle. And it almost never bled a bit. And the reason for that is that the subcutaneous tissue has very few capillaries and it doesn't bleed much. So it allowed us to get down to the abdomen with very little blood loss, which was a good deal. Human body has hair all over it, except for a few places, which you see there. The palms, the soles, the lips, and some portions of the external genitalia. I'll let you guys figure those out. Functions of the hair. The hair protects and insulates us. I told you the story about my cat and looking real poofy when the erector pili muscles make the hair stand on end. Our hairs also protect openings like our ears to keep bugs from crawling in our ear, and our nose to keep bugs from going up in our nose, and dirt and stuff. A lot of it is picked up by the hairs of your nose. I already mentioned the fact that hairs are sensitive to very light touch. So, I think the hair follicles are kind of cool to look at. There's not really much to them. Just know that the hair follicles are located pretty deep down in the dermis, and so if you pull a hair out, you're gonna pull it out, and you're gonna see the root of the hair is going to be hanging on to it, and it's going to be, it's going to be a half a centimeter long or so. But the hair itself is non-living. That's nice, because when you go to the barber shop, I'd hate it if it was ow, ow, ow. But it's not, because the hair is already dead. The base of the hair is wrapped in this dense connective tissue, and surrounded by the root hair plexus, which we talked about as the nerves that are around the base. The accessory structures, every hair has an erector pili muscle, which is involuntary. You can't tell your arm to make your hair stand up on end, so you know it's involuntary. You know it's a smooth muscle, not a skeletal muscle, and certainly not a cardiac muscle. It's a smooth muscle, makes your hair stand up, produces goosebumps. Now, we're not hairy enough anymore that really these matter. It's kind of these are muscles on the way out, so to speak, evolutionarily wise for us. But for a lot of animals, they're very important, keeps them warm and so forth. There's also a sebaceous gland attached to every hair follicle that lubricates the hair and helps control bacteria. The hair root is the lowest part. It's the one that's down there. And remember that the epidermal skin cells go all the way down to the bottom. And the hair shaft is the upper part of the hair that is dead. So this is a pretty good example of one. Here's this connective tissue sheath that surrounds the hair follicle, the base of it down here. Here's the nerves that go into the root hair plexus down here that allow us to feel when our hair get moved. Here's the erector pili muscle. Notice that the erector pili muscle always goes from the connective tissue sheath here of the hair follicle up to the epidermis up there. And it's always on the same side as the sebaceous gland. The idea here is that if you ever do get goosebumps, when this muscle contracts and squeezes, it also squeezes on this sebaceous gland and makes a little bit of oil go out there as well. So it's kind of a dual function there. Not only does it make the hair stand up, but it also empties the sebaceous gland a little bit. This is what it looks like in cross-section. I don't care that you know this. Like everything we're going to find in medicine, in the body pretty much, the medulla, the middle of it's going to be called the medulla, and the outer parts are usually called the cortex, which you see here. This is just all that external root sheath, that connective tissue sheath that you see. I don't think that's important. The things I've said are, I think, about enough. I would reinforce this point about the hair cells going all the way down. I mean, the skin cells extending all the way down to the base. And the reason that's important, and we're going to get to this in a little bit, is if you get a second-degree burn and you burn your skin and you burn everything down to here, for example, that's all dead, everything from there up. Well, you still have skin cells down here. Those skin cells are still alive. And assuming you're recovering from your burn, then these skin cells can climb back up and go out on the skin and grow your skin back. Whereas if you have a full thickness burn, which is a third-degree burn, that means you burned it down below here, and there are no skin cells left. That third-degree burn is going to have to be grafted. You're going to have to get skin from somewhere and put that on that area. That make sense? The book splits this up a little bit and calls this area down here the hair bulb and the little hair papillae. I don't know how that's, but anyway. Here's a nice microscopic example of it. Some hair follicles. But you do need to look at those under the microscope. And they're nicely illustrated on our models as well. So, I think there's about two things you need to know about hair growth. Note that the bulb down at the bottom is where the hair matrix, which is the part that's going to become the hair that you know is hair, that's where it's produced. It's all produced down there in the base and the bulb. And as the hair continues to grow, it pushes the hair up and out of the skin. Surprise, surprise. There's this medulla, cortex, and cuticle. The cuticle, this is the outer layer. This is the one that people spend all these millions of dollars trying to get the oil content just right. And also they dye it and change its color and all
Why sometimes on the whole there's two hairs coming out and so itchy? Like,
There's two hairs coming out of one hair follicle.
yeah.
I think it just looks like that. I think there's just two hair follicles that are very, very close together.
And it's so itchy. So
It's what?
itchy.
Itchy. That's dermatitis. If it's itchy. Keratin, remember keratin is the protein that we found in skin cells as they work their way up to the surface. And the closer they got to the surface, there was more keratin in it. That's why they became more leathery and dry. That's basically the same protein that hair is made of, although it's kind of pure keratin. It starts down in the bottom as soft keratin, but as it grows up and as it goes out, the outer layers become hard keratin. Once again, I don't know how important that is. You do need to understand something about the hair growth cycle, because a growing hair that's alive and healthy and growing is firmly attached to the matrix. There's another group of hairs that we call club hairs, and club hairs are not growing. They are not attached to an active follicle, and as a result, they are dying. And if these hairs might grow a little bit, but then they're gonna fall out. And if you have enough club hairs, you're gonna go bald. Okay, you're losing hair. Now, can these hair follicles get reactivated and come back to life? Yeah, they can, but that's pretty unusual. Usually, you lose your club hair and you're kind of out of luck. A couple other types of hairs that you ought to know about. One's called vellus or vellus hair. It's very soft. It's very fine. This is the kind of hair that's on a baby skin. Very soft, very fine. We actually have vellus hair in parts of our body that have really, that you don't even think of as having hair. I'm a pretty hairy guy. But, like right here on my wrist there, I don't have any hair. But if you got a microscope out and looked at that, you'd probably find I have a bunch of vellus hairs there. Terminal hairs are interesting. These are the ones that are very heavy, very pigmented, and they only grow to a certain length, and then they stop. Perfect example, your eyelashes and your eyebrows. They are different than your other hairs, and they're kind of thicker. Most people's eyelashes won't need to be cut every 6 weeks like your hair does, because they only grow to a certain length and then stop. Some of us have longer eyelashes than others, and people think that's a pretty thing, but it's just a matter of how long their hairs grow, I guess. By the way, these things here don't ever shave. Don't ever shave your eyebrows and your eyelashes, because they may never grow back. Most of the time they don't. And I will tell you that if you get a patient in the emergency room who comes in, their face is all cut up and it's all bloodied, and the doctor says, "Yeah, would you shave that area, clean it up, and shave it?" Don't ever shave anybody's eyebrows for sure, because they'll sue you. Because if they end up the rest of their life with no eyebrow, they're going to be very, very pissed off. So to me, that's the main thing to know about these terminal hairs is don't ever shave them, because they may not ever come back. And it's pretty much malpractice to cut anybody's eyelashes or eyebrows. You just sew the cuts up. If the eyelashes get in the way, too bad. Just do the best you can, but don't shave it. The sebaceous glands, let's talk about them for a minute. Those glands that I showed you the pictures of a minute ago that are attached to the hair follicles, they are oily glands. That's the ones that gives you zits when they get clogged up. They form little whiteheads. If they get infected, then they get red and inflamed. They secrete sebum. Sebum is made by sebaceous glands. That's what the white stuff is that you squeeze out when you squeeze a whitehead. These are holocrine glands. Remember when we talked about the 3 kinds of secretion? Eccrine, apocrine, and holocrine. Holocrine is where the whole cell sort of falls off. That's what these are, sebaceous glands. So it's pretty thick stuff. As far as sweat glands are concerned, there's a bunch of sweat glands scattered through your skin. They're in two types, and you can't look at them and tell the difference between them. You just have to know that most of the glands are, most of our sweat glands on our body are merocrine glands, and then we have apocrine glands that are only found in a couple of places: under your arm, in your groin, and on your nipples. Wow. The apocrine glands are the ones that smell. And merocrine glands just secrete water and sweat. That doesn't give you body odor. The apocrine glands, on the other hand, do. I'm sure there's some evolutionary reason for that. Maybe to scare the tigers off or something. But
Those are the ones that just ooze, right?
what?
They just ooze, right?
They just kind of ooze, yeah.
Yeah.
They don't pour out like merocrine glands can when you're really sweating. So both of these make watery secretions. It's pretty watery stuff, and I'll just leave it at that. There's different kinds of sebaceous glands. I don't think you probably ought to know this. Some of them are really simple. These are the simple sebaceous glands are the ones that are attached to the hair follicles. And then there's these guys called sebaceous follicles. Now, sebaceous glands are the ones attached to the hair follicles, right? And then there's sebaceous follicles. And they are sebaceous glands that just go right out on the skin, okay? And you'll be able to identify those in the lab under the microscope and on the models. The sebaceous follicles, they look a lot like regular sebaceous glands, except they don't go into a hair. They're just going right out to the skin. That's what makes them. That's why people get oily skin. People who have a lot of sebaceous follicles that are really active makes their skin really oily. So here's a couple of examples. This is a hair follicle right here. This is a sebaceous gland. Here is a sebaceous follicle. It looks pretty much the same glandular structure as this, except instead of going to a hair, it goes right out onto the skin. This is a couple of slices right through the hair follicle and the sebaceous gland, as you see illustrated on that picture right there. You've got the hair's been plucked out and removed. It would go right there, and then there's all this oil that's being secreted by these sebaceous glands right into the shaft of the hair follicle. The apocrine sweat glands I mentioned to you, they're only found in 3 places: your armpits, around your nipples, and in the groin. They produce a thick, kind of cloudy secretion. Not a whole lot, but when they break down, they smell and cause odors. And I think I'll just kind of leave it at that. These are the hormones. I mean, these are the sweat glands that respond to hormonal or nervous signals, like getting scared, your armpits sweat, getting aroused, as with the sebaceous glands around your nipple, and so forth.
So it's like pheromones?
What?
Would it be like pheromones?
Yeah, like pheromones. Good point. Here's another sweat gland here. This is your basic. There's an apocrine sweat gland, which is a bigger gland that then secretes to a hair follicle. This would be like in the armpit or around the nipple. We have examples of these glands, but the only ones that I remember ever seeing in the lab are like this. They are American sweat gland. Well, that's a regular American gland. I think we have some apocrine glands that are just go to the skin as well. Eccrine sweat glands are the ones that really sweat. They secrete watery fluid. They go directly out onto the skin. This is what we call sensible perspiration. This is some ones you can actually see. I probably sweated about 1 liter this morning already. I went to the club and got on a stationary bicycle and rode like hell for an hour. Whew, I can feel it still. But I was a little sweat ball, and I would, if you just take and weigh your workout clothes before you work out, and then you weigh them after you. I'm sure there was 1 liter, 2 pounds of water on them because they were soaking. And all I wanted to do was throw them in a plastic bag and take them home for the washing machine. That's what I did. I wouldn't even put them back in my gym bag. Anyway, sensible perspiration can be huge amounts to cool your skin, to get rid of the extras, to help you get rid of salt and electrolytes. It also helps you flush microorganisms and harmful chemicals from your skin. I would just say sweat is good. Here's what they look like. They look like these guys here, and notice that they pretty much go right up here to the skin. We have good examples of those on the models over there in the lab, and you can see them under the microscope easily. Mammary glands are a little different. They produce milk. Remember, this is why we're called mammals. It's because we feed our newborns with mammary glands. We also have another kind of glands that are different than anywhere else, and they're called ceruminous glands, and they produce cerumen, and that's earwax. And if you want some real fun later tonight, put your little finger down in your ear, rub it around. I love that feeling. It feels so good. And then smell it. And it smells really yucky. And the reason it does is to keep the bugs out of your ear. It's a protective thing. You really don't want bugs crawling in there and making a home. One of the ways our body fights that is producing earwax, and also, and it smells bad, so it keeps the bugs out. Never thought about that, did you? I wonder why that smells so bad. So what controls these glands? Well, they're all controlled by the autonomic nervous system. You haven't learned about that yet. You will when you get to 232. The autonomic nervous system is the automatic nervous system. It's the things that are controlled deep in your brain, and you have no control over. Like when you sweat, heartbeat, how much you breathe, all that jazz. Whether you get goosebumps, whether you shiver, and so forth. So, I'd just leave it at that. Sweating can occur locally. If you put your hand out, your arm out in the sun, it will sweat. That doesn't mean the whole body sweats, because really your whole body isn't hot. So there is some local control on that, and I think that's probably worth knowing. Thermoregulation is the main function of sensible perspiration. If you start getting too hot, you're going to start sweating. It works with the cardiovascular system to send more blood past the skin, to act as a radiator to get that heat out of you. I'll just leave it at that. Let's talk about nails for a minute. Another thing that women spend a lot of money on for some unknown reason. I would just tell you that you need to know these parts of the nail. The eponychium is your cuticle. It's the part on the back of your nail up on the top that you go to the nail person and they push it back and make it pretty for you. So that's the eponychium on the back end. On the front end up here, underneath it is called the hyponychium. I think it's on the next picture. But anyway, eponychium and hyponychium underneath. Your nails are just like your hair. They completely form back here at the base, and they gradually work their way out. You have a lateral nail fold out here on either side, and the reason that you don't want to rip your nails back below the edge of your skin out here, especially your toenails, is that if you rip this nail off, like right here, rip it back to here, then when this corner right here grows out, it will grow into the tissues. It'll grow into these tissues out here, and that's what causes an ingrown toenail. Anybody ever had one of those? They're incredibly painful, and it's 100% preventable by just never cutting your nails or ripping them off, so that the edge of the nail always needs to stay out beyond the end of your toe. So, cut your toenails or get somebody to cut them for you, but cut them off kind of straight so that these corners don't get torn off back here, and so they can grow into the skin. I will tell you that when I was on the ship, we had 5,000 men on the aircraft carrier out in the Mediterranean, and I would say I would take off 2 toenails a day. Guys would just, they'd be laying around in their rack, and instead of taking the time to cut their toenails with nice toenail clippers, they would just kind of pull them off, and they'd get an ingrown toenail, and man, they would come in, they were in incredible pain, they were really red and swollen, pus dripping out around the corner of the nail over here, and I had a simple solution for it. I just took their nail completely off. I go back here and numb up their, this was a toe, this looks like a finger here, but take a numbing shot and numb around here, and then their whole tip of their toe would be numb, and then just get a hemostat and grab onto the toenail and kind of free it up off the nail bed. This is the nail bed right here, and just peel it off and take it completely off. And, well, that instantly takes most of the pain away. The infection clears up in a day. They just soak the end of their toe and they feel a lot better. But it looks really ugly. And it takes, a month or so for a new nail to grow out. And hopefully as that new nail grows out, they keep the corner, as the nail grows out here, they keep it from digging down into this groove here and causing the problem again. But it almost never happens because it goes so slowly. And if they just look after their nail at all, they'll never have another problem with it. Sometimes I would just take off half a nail, but I don't know. We kept them in a jar, so it was kind of fun. We tried to collect as many as we could. What are our nails for? They're there to protect our fingers and toes. There's a bunch of changes that you can see when looking at nails that help you diagnose different problems, especially different nutritional disorders will cause different changes in the appearance of the nail. The nail body, that's a silly name. It's just the visible portion of the nail that lays on top of the nail bed. If you take one thing you do, if you take your fingernail like this and you push on it, you can push the blood out and it gets white. See that? And then when you let go of it, 1, 2, 3, it should take about 3 seconds for it to turn red again. If you've got reasonable circulation. People that are anemic, they're not nice and pink. They're much whiter because they don't have as much blood in their blood vessels. And so that's another thing you can tell. The lunula is that little crescent down at the bottom that you can all see at the bottom of your nail. The lunula means it looks like a moon, right? And they have these grooves on the sides. And I think that's enough to say. The skin underneath the front edge of the nail is called the hyponychium, and people get funguses and stuff in there. I just leave it at that. One thing you need to remember is how close your nail is to the phalanges, the distal bone in your fingers. It's really very close. This is a very close distance right here. And so if you really kind of look at it, you can kind of figure that out, but I don't think people think about that much. So if you do a lot of damage to your nail and you get a bad infection in there, that can get into the bone, and that would not be good. So take care of your nails a little bit. Yeah?
Can it be like vice versa? Because I have a friend who lost their finger, and at the end of their finger, they were growing a nail.
Yeah, usually what happens, in an injury like that is you don't destroy the whole nail bed. So any nail bed or any part of this bottom part of it, it will continue to make nail. So if they lose their finger right across here, for example, they've got a little bit of base down here, so they're gonna keep making nail. It doesn't have any good place to go, so it just looks weird hanging there on the end. If they'd have come to me, what I would have done is I would have taken off that last little bit of nail and then just taken some silver nitrate or something that would destroy the rest of the nail bed so they didn't grow any more back. I mean, if you've lost the tip of your finger and you have a piece of nail hanging out there on the end that's not doing you any good, it'd be better to just destroy it so it doesn't keep coming back. But anyway, so here's the kind of a close-up of the end of the finger. With the bone down here, and the nail bed right here, and the hyponychium here underneath, and the eponychium up here, the cuticle, and the nail root, base of the nail is back here. And I'll just leave it at that. Notice that the dermis on your fingers is very, very tough, and it's very tight, and you can't really move it around much. Because it is so tightly attached to the bone underneath, which really gives you good traction to pick up things with. Let's talk about repair of bleeding. For example, if you cut yourself and repair of an injury, the first thing that happens, of course, is inflammation, which we said happens pretty much every kind of injury we get. You notice there's blood coming out of the little blood vessels. Notice there aren't any blood vessels up here. But this blood kind of pours into the wound and it clots, and it gradually is invaded by a bunch of macrophages that come in to pick up any dead cells or any bacteria, and this clots. This is now called granulation tissue. Somebody mentioned it the other day, I think. Granulation tissue is like proud flesh. We used to call it just kind of reddish stuff that grows. And it's growing underneath the scab for a while. And even though your mother has always told you not to pick your scabs, everybody picks their scabs, right? And at a certain point, it's fine. You pull the scab off. But it's probably better to just leave it as a covering for whatever's underneath it. These wounds all heal from the bottom up, and it's illustrated right here. Fibroblasts start to move in. Fibroblasts make more fibers, especially elastic and collagen fibers. It gradually pulls it together, and then new skin starts to grow in from the two sides until you have a full layer of intact skin cells across there. This eventually turns to scar underneath. You have a little bit of scar, and you see the scar extends on the surface out here a little bit. So that's kind of the way injuries recover. Keloid is an overgrowth of the scar tissue. Darker races tend to make a lot more keloid than lighter races of folks, and you've probably seen pictures of tribes from Africa and from the islands of the Pacific where they actually decorate their body by making little cuts and creating scars, creating keloids in really fancy, really kind of beautiful patterns. It's the old form of tattoos, I guess. Here's a keloid, just a little bitty wound that busted open and healed back and then didn't heal well. Quick rule for you EMTs and folks out there, way we think about it, called the rule of nines. If somebody comes in with a burn on their body, one of the things you need to know is about what percent of their body is burned, because all of your treatments are going to be based around what percent is burned. The larger the percent, the more weeping of fluid, the more weeping of proteins out of your skin, the more loss of temperature, and so forth. So it's nice to figure out about what percentage is burned. And you get somebody in the emergency room and you can kind of count this up pretty quick. The lower limb is about 9% on the front of the leg and about 9% on the back of the leg. The arms are about 9% on both sides. So the arm is about 9%, 9%, 18%, 18%. The front of the trunk is about 18% on the front and about 18% on the back. And I think that all adds up. Oh, the head is 9%. and then that leaves the last 1% for the genitalia. The absolute worst areas to ever get burned are your fingers and toes, because you need, when you can't flex your fingers and all is scarred due to burn and the subsequent scar that's going to form. That's a terrible area to get burned. Obviously, your face is terrible. Genitalia are terrible. Burns are just the worst. Notice that a child, and there's charts around in most emergency rooms that'll help you with this, but kids, the biggest thing with kids is their head is so much bigger in relation to their body. So don't memorize any of these numbers. Just, you can think about the 9 rule, but don't worry about the kids. But just know in general that the kids have a larger percentage is assigned to their head than anything else. Here's a 3rd-degree burn where the skin and everything is destroyed down here into the subcutaneous area. That is not going to grow back. This whole area would need to be, eventually need to be grafted. The classic 3rd-degree isolated burn is the guy who's out riding his motorcycle and doesn't have on leather boots, and he touches the side of his leg to the exhaust pipe. And if it's an area this big that touches the exhaust pipe, he's got 3rd-degree burn in that big an area. And you wonder, well, gosh, how are we going to treat that? Well, the common way to treat that, it's really one of the few burns that the best thing to do is just cut all the dead stuff off, cut all the burn tissue off, and put a skin graft on it. The minute he comes into the emergency room, just go and operate and fix it, because it's not going to heal on its own. You can wait 2 weeks and let it kind of slough all off and peel all that dead tissue off, but that's a good way to do it. I know that the burn management has changed a lot. They're now growing skin cells in culture. So if back in the day, I'm dating myself, we would take, if somebody had a 30% burn on their front side, you would go back to their back side and take the skin harvesting thing and shave off a piece of skin like this. And then you would run it through this thing that would mesh it. It was like make a pie crust out of it, allow it to stretch out. So usually you could stretch it out to be about 3 times bigger than it was. And you'd stretch it out, sew it on, and it would grow there, and then it would fill in the little holes and work pretty well. Obviously, that was a huge problem, though. If somebody had an 80% burn, you only had 20% left to graft from, and that was going to require multiple graftings like that. Now what they do is they take some skin cells from the patient and stick them in the culture lab, and they grow billions and billions of skin cells in culture, and then they just spray them on with like a spray gun. And enough of them live to reestablish skin in different areas. Burns are tough. I had rotations in the burn unit, and it's a very disheartening thing, especially when it's kids that are burned, and especially if it's kids that were burned from abuse. That's the worst. Kids, daddy takes their arm and sticks them down in boiling hot water and burn their whole hand, and they're looking at a year's worth of recurrent surgeries and then physical therapy to get their hands working again, and plus having to live with someone you cared for doing that to you. Effects of aging on skin, and the skin gets thinner. You have fewer of those dendritic cells. Remember those dendritic cells? What do they call? What do they do? Immune cells. That's right. And obviously, if you have less immune cells and you're old, you get sick and have more troubles. You're not quite as vital, I guess you'd say. You don't make as much D3, so if you don't have as much D3, what happens? Your bones get weaker. You get osteoporosis and weaker bones in old folks. Decreased melanocyte activity. You don't have as many melanocytes. You don't have as dark a skin. You can't be out in the sun as long. You probably don't see too many old people laying out at the beach. The reason you don't is because they burn really fast, because they don't have as many melanocytes anymore. Although you see some of these really old ladies that have tanned every year their whole life, and man, they look rough. And another thing about aging is that the glands don't work as well. And that becomes a real issue during a heat wave. Heat wave comes through Portland here, and temperatures get up to about 100, 105 for 2 or 3 days. It's really important that you go check on your older neighbors because they can't sweat like you can. And because they can't sweat, they tend to get hyperthermic. They can get too hot and die from it. So, you need to look after your neighbors, especially as they get older. Old folks just don't handle the heat as well at all, but this is one of the main reasons. They just can't sweat like they used to. The end. We have enough time. I'll show these. This is just a squamous cell carcinoma. Don't take notes on this. Just look at them. This is a cancer of the squamous cells on the top. These are common. They have to be removed because they just keep growing, but they don't spread and kill you. This is just a mole. Check your moles frequently. And the reason is if moles really start to change, if they really start to get darker, if they get thicker, then it ought to be evaluated and see if it's an early melanoma. If you treat melanoma early, it's very curable, but if it gets along too far, it's not curable. This is a raised mole. This is not malignancy, not a cancer, but notice that it has different layers and it has a somewhat irregular margin. That's not a good sign either, is when they have irregular margins like that. This is very suspicious of a melanoma because it has multiple colors. That's a bad deal. That's probably a melanoma. Another one with irregular margins, little islands of darkness out here and here, and raised. That's not a good thing. You guys think having these tattoos is like no big deal? Well, just hope you're not allergic to one of the dyes. This person here was allergic to the red dye, and all of this skin that you see bubbled up there, that all died and turned to scar. And I can assure you that is one very ugly arm. Just simply an allergic reaction to the dye. These are clubbed fingers. Clubbed fingers are something you see in old guys that have smoked their whole life. It's caused by not enough oxygen getting to the tips of their fingers and toes from years of lung abuse. Clubbed fingers are absolutely diagnostic of lung disease. You see that, you can just bet the patient's probably got 70 or 80 pack years of cigarette smoking. Little lady with a burn here. You notice the white areas here are very deep second-degree burn. A lot of this is less than that, and it's starting to heal already. I think this is day 12. Yeah. Watching burns heal is a real education for you as well as the patient. This lady kind of fell into the tub with both hands and got burned. Frogs give you warts. Not really, but people do get warts. It's a virus. Most of these can be simply frozen off or burned off. Some patients who have it really bad, you actually take the wart tissue itself and turn it into a cell culture, and it generates antibodies against the viruses. And then you inject the viral cells in their body, and it goes around and kills their warts. Whiteheads, these are just the sebaceous glands in the skin. When they get clogged up, a lot of it's related to hormones, and that's why when we were teenagers, we all had acne, and we hated it. This is psoriasis. A lot of ads on TV these days for these new drugs that, by the way, are between $5,000 and $15,000 a month to treat plaque psoriasis, they call it. These are basal cell carcinomas. These are skin cancers as well. Once again, it's not the bad kind. You have to remove them, but they generally do not kill a person. Sometimes you'll get a basal cell like this, and you'll go in surgically and you'll take it off. So you make a margin around it like that. You take it off, the piece you took off, you then send immediately over to the path lab, and they cut it all up and look at it to make sure that the edges, the margins of what you took off, have no cancer cells in it. You can't tell with your naked eye. If they do have cancer cells in it, then you just take the person back into the little operating room and you go deeper. Take more off. Send that over to the lab and get it checked. And I've seen patients who had to go back 5 times in one morning and get more and more off. It just creeps and gets to the deeper tissues without it looking like it is. But once you get it all cleaned out, then you're done. It's going to be cured. These are all melanomas. These are the bad actors. These are the ones that kill folks. Although major advances have been made in the last year or two here in Portland, down at the Health Sciences Center, with using immune techniques and genetics to fight melanoma. We didn't have any treatments for melanoma. I have to tell you that when I practiced, we would take out bigger and bigger chunks around them. And if you got them in the first shot, that was great, but most of them you didn't. And the patients were probably going to die, although maybe it was many years later. But it was not unusual if we had somebody that had say a spot that was even 1 centimeter in diameter on their back. We would take out a piece of tissue this big around it and then put a skin graft or something on it, because that was your only shot to cure them of their melanoma, was the first surgical excision. We would take 10 centimeter margins around it. Now, obviously, if it was on their face, you didn't take 10 centimeters, but melanoma was a bad actor, and it's nice now that it sounds like they're coming up with some good treatments. People do a lot of things to their skin. A lot of things are advocated by different people. I think it's mainly done for money, but that's okay too if people want to pay for it. Microabrasion, which is basically sandpapering the skin, especially in people that had a lot of acne as a young person and their skin is really rough. This is a kind of treatment that they're getting. Different laser treatments are designed to take out the dark spots like this one. This is basically leftover from teenage acne probably, and it looks a bit better, I think. Diode laser therapy, this is acne 6 months later. That's probably going to get more treatments, I suspect, to continue to improve that, hopefully. Collagen injections in the lips, I think, is the stupidest thing I've ever heard of, especially when you see some of the disastrous actresses that have these stupid-looking, huge lips. I know, like, what in the world? What were you thinking, honey? This is bruising. These are contusions. This one's, unfortunately, this is not somebody that got hurt. This is a patient with leukemia. And kids with leukemia can't clot their blood properly, so the slightest little touch will cause it to bleed under the skin. That's what this is right here. It's called ecchymosis, which is the black and blue. Jaundice, usually caused by liver disease. You can get jaundice if you get hepatitis. You can get jaundice if you get a blockage of your bile duct, things like that. Here's a kid with hepatitis and yellow eyes. It usually starts in your eyes and then it spreads to your skin. It's easier to see when it's in your eye. So whenever you're looking at, you're examining patients, you always look at their eyes well enough to at least tell if they're yellow. Here's hyperkeratemia, people eating too much carrots, basically. Stop it, a few months later, gone. So even though carrots are good for you, don't eat too many. Here's a baby with hyperkeratemia, kind of orangey looking. This is called periorbital edema. This is usually caused by allergic reactions. You notice how all the swelling there is there in the eye. Fluid tends to collect in your eye and around your eye because it's not held very tightly. Your skin is kind of loose around your eye, so it's a good place for edema to happen. This is what I was talking about with pitting edema, when I would put my finger on the patient and kind of push on it for a minute, and then if it doesn't snap right back, that's a sign that there's too much water in the skin all around it. When you put your finger on there, you're pushing the water out of the way, and it doesn't come right back. Cyanosis is the blueness from not enough oxygen in your blood. Usually you see it in the fingertips and in the lips. This is a blue baby. I don't think the colors reproduce as well as maybe they could there, but you can see the baby's fingertips are kind of bluish, and usually their lips are kind of blue as well. It's usually a hole in their heart. If you think this is reality, you got another thought coming. These are nice. These are not photographs. These are pictures, you know, and an artist can make a perfect butt out of that thing. But this is from a liposuction advertisement. I promise you, it doesn't work this well. This patient would be much better going to the gym. This patient could lose 10 pounds and do a bunch of exercises and look more like that than they'll ever look like with liposuction. Petechiae is a skin disorder where all the little blood vessels break. Petechiae are really common if you sneeze really hard or a whole bunch, or if you're coughing a whole lot, you'll oftentimes get petechiae around your face. If you drowned, you'll get petechiae. If you get compression of your chest too much.
What's the connection between that and spinal meningitis?
Between what, petechiae?
Because I remember when they thought my son had it, they said just because he had a purple spot.
He had purple spots. I don't know the answer. Meningococcal disease is what you're. Yeah. I don't know. Lips, ugly. Facelifts. Facelifts. This is all they do is they just pull your skin back. And I did a plastic surgery rotation to help the guy do a bunch of facelifts. Pretty amazing surgery. You make an incision here and you just lift the skin up and peel it all the way up here around their nose and around their lips so you can lift all that skin off. And you pull it out and you trim off about half an inch or an inch maybe and then sew it back together. It makes your face tighter, but God, that's what it looks like in reality. It's Phyllis Diller. I think she had about 7. Skin grafting for hair follicles. Here's 2,000 grafts that have been put in there. They went back and put in 1,500 more. Still, does it look that much better? We're talking $10,000 or $15,000 here for a bunch of hair transplants. I don't get it.
Do they really use the hair follicles from your butt?
No, you use the one from out here on the side.
Okay.
Yeah. Most people, even bald guys, have hair out here. So the hair on the sides of your head interacts differently with the testosterone. And so you can harvest hair out here and use that then to put up here.
It's gotta be pretty painful.
I don't think I'd want it from my butt.
Well, I just heard
hate to comb that little stuff through.
I was thinking, how does it come out looking like normal hair that you have on your head? You know what I mean?
That's my bike trip last summer in St. Louis at the St. Louis Arch. Let's just take our quiz here. If y'all would clear your desks. I'll pass one of those out to everybody, please. If you don't have a number 2 pencil, we're going to do these with a Scantron. If you don't have a number 2 pencil, come up here and get one from me. I've got a bunch of extras. Just a quiz. They're in that box right there.
Are we using Scantron?
We are. I've got some for you.
Okay.
Since I didn't warn you, I brought them for you. I don't see one. And I can't believe there's not one in there, right? does. Hey.
We can write on these, right?
You can write on the packets, yes. Please put your name on it up at the top. And put your name on your Scantron, obviously, as well. That's me at the St. Louis Arch in St. Louis, Missouri. It was kind of a fun trip. I would highly recommend it to anybody. Why does it pop to slide 146? Okay, skin. Skin is the largest organ. We're going to learn about that, but it also plays a very huge role in our society. I think the word skin conjures up lots of thoughts. When you think skin, what comes to mind? Anybody? Color. Yeah. Protection. Yeah. Good. Yeah.
Health.
Health. Yeah. Excuse me?
Gumby.
Gumby.
That's how I remember it in documentary.
Yeah, okay.
Beauty.
Beauty, absolutely. Beauty's skin deep, right? No, it's not. You know, we spend a lot of money on our skin. Some of you folks spend lots of money smearing crap all over your skin to make yourselves turn darker, right? That's what tanning is all about. Skin involving subjects who are nude, especially devoted to showing nudes like Skin magazine. Michelangelo made the comment, and if you've ever been to Europe and seen Michelangelo's stuff, everybody's naked. He made no bones about it. What spirit is so empty and blind that cannot recognize the fact that the foot is more noble than the shoe, and skin is more beautiful than the garment in which it is clothed? That's pretty true. Martin Luther King, as long as we're on the subject, I have a dream that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I think we're seeing that still play out. By the way, one thing I didn't mention, I kind of mentioned too, if you have never watched the entire I Have a Dream speech, every one of you has seen a 30-second clip, and a minute clip, and so forth. But if you go on YouTube, you can watch the entire thing. I think it's about 57 minutes. It is really worth it. One time in your life, you should listen to the whole thing. It is amazing. It was also in 1963. Beauty to me is about being comfortable in your own skin. Either that or a kick-ass red lipstick. Gwyneth Paltrow. She's pretty deep. Red Fox, beauty may be skin deep, but ugly goes clear to the bone. That's what we used to always say. I think the skin has really been transformed in the last 15 years into a palette for art. It seems like everybody has a tattoo. I'm never going to have one, because I think it would hurt. Plus, I used to be a surgeon, and 85% of all people who ever get a tattoo at some time later in their life want it off. And luckily now they're coming up with lasers and stuff that can take them off. Back in the day, all we could do was cut the skin out. And we did that all the time. People wanted, they'd have skin grafts and all kinds of stuff to get that tattoo off of me. I remember this one guy came in, he had this great big battleship, Eagles and U.S. Navy, and I love Mary or something like that right in the middle of it. And he came in and said, Doc, I'd like you to take the whole thing off. I said, man, that's going to cost a lot of money. You're going to be in the hospital for a week. That's a big, big deal. He says, but I said, I can take off Mary. So I made a little elliptical incision, took out Mary and put the skin back together, and he walked out and he was happy as a clam. He just didn't want Mary on his chest anymore, I guess. I think people take it to the, take it a little too far sometimes. Would anyone like to comment on those eyebrows?
Wow.
Or those eyelashes? Yowzers. Few piercings. You guys have all seen this. Here's all the stuff that you can buy. Skin tanning beds are a big deal. There recently have been laws passed that children can't get in them anymore. Probably good because their skin is so it's so reactive to the sun. Would you call those tan lines or burn lines? I'm not sure. And just as a lot of folks want to have their skin darker, a lot of people also want to have their skin lighter. I was over in Thailand visiting with my son, and he said over in Thailand the custom is that if you're dark, you are poor. And so the poor people that work outside, they're manual laborers, they completely cover up all the time. They have big hats, they have scarves around their faces, they have long sleeves, they always wear gloves so their skin will not turn darker from being in the sun. It's a sign of social status in Thailand. There you go. I don't know. That was the life the young cowboy had dreamed of. Where else could you find people out in the sun with no regard for sunscreen? Yep, this was the Wild West. I've probably put suntan or sunscreen on myself maybe 5 times in my life, maybe 10, hardly ever. It never did make sense to me, and I'll tell you why later. Another thing is hair, because hair is part of our skin, and a lot of us want to make more hair grow, and we work really hard on that. And so we have all kinds of treatments to grow hair, and then we also have lots of treatments to remove hair. I remember driving down 217 one time about 2 years ago, and there was this huge billboard that said, bald, grow hair. Come to some treatment center where they were doing hair implants. And then not half a mile farther, there was another one that said laser hair removal. And, you know, huge billboards, huge big money. This is something that I find it really hard to believe. That if you look in the magazines and look in advertisements, you will never see a man who has any hair on his body anymore. Every model is completely shaved. Underarm, chest, everywhere. They're completely shaved. I guess that's okay, but it must seem like a lot of work. Hair transplants illustrated here. That's probably $25,000 worth of hair transplants there. Donald Trump and other people that do all this kind of combing around their hair. New scalp exerciser driven by electricity. Wow, this is back in the 50s. Massaging this guy's head. It looks like it's not working very well. This is a disease, I don't know if you'd call it a disease. This is vitiligo. Vitiligo is a condition where you lose pigmentation in certain areas of your skin. This is what Michael Jackson said he had. And because of this, he started treating his skin with skin lightener. And so he went from this really handsome-looking black guy here to this whitish-looking freak, in my book. I think 20 plastic surgeries as well. But notice the color of his skin is very, very light. And he had all kinds of skin treatments for that as well. And he says, I have a skin disorder that destroys the pigment of my skin. It's something I cannot help. Okay. Yeah. Okay, Mike. Skin flicks. Skin heads. All kinds of thoughts. Playboy. I used to buy them for the articles, of course. I love this this cover, though. This is Christy Brinkley. And, you know, Christy Brinkley, I saw her on TV the other day, it seems like, and she's still just as beautiful as she was. This is in 1986, I believe. Playboy's going out of print here in the next month or so, I think. And, but this was in 86, and it was $3. I think by the time it went out of print, it was like $15 a copy, wasn't it?
Look at me.
Don't look at you? Okay.
Yeah.
Like 7, I think.
Huh?
I think it's like 7.
Yeah. Pretty spendy. Moles, you know, what would Julia Roberts give for per mole? You know, is she the one with the big one? Or?
Cindy Crawford?
Cindy Crawford, there you go, that's who it is. This is the thing I really worry about. I just mean to give you a little public health notice here. Don't do this. Don't put the piercings through the cartilage of your ear, as I mentioned before. If you stick them through the cartilage, it's okay to put them around the edge, and it's okay to put them down in the earlobe, but if you stick them through the cartilage and they get infected, we're going to learn about cartilage a lot here. We already have, and remember, cartilage has no blood supply. So if you get an infection in the cartilage, it's going to end up looking like this, and the entire cartilage is going to have to come out. That's going to leave you with the ugliest ear you've ever seen. Yeah.
Those rules still apply. Those rules apply with like nose piercings.
Nose piercings?
Yeah.
If they go through your cartilage, it can give you the problem. It's not as much of a problem as it is on the ear. The cartilages are really small in your nose. It's a bunch of them. But there you go. And you know, what we had to do for this ear, this is an ear I took care of, is first of all, you take the bone out, or whatever you call that thing, and you flip the ear over and back, numb it all up, make a big incision the length of the ear on the back side, and then just kind of start scooping out the infection, which is cartilage and dead cartilage and so forth. And usually then you have to have it come back 2 or 3 times a week from now and another week from now to scoop out more until you get all the infection cleared up. It's hard to clear up this kind of infection because it's in cartilage. The integument is the largest system. So we're talking about the integumentary system. That means skin, obviously. It actually makes up about 16% of your total body weight. We normally have about 1.5 to 2 meters squared. In other words, if you laid it all of your skin out and stretched it out, it would be about 2 meters, 1 meter by 1 meter, and then another one just like it. So, you know, it takes one person to make a good purse, maybe 2 people to make a good lampshade. Just kidding. So the integument is really made up of just 2 parts. The cutaneous membrane, which is the skin, and then all these accessory structures. Now, when we talk about accessory structures, we're talking about sweat glands, we're talking about hair, we're talking about nails, fingernails, and so forth. I think that's about it. The cutaneous membrane of the skin, it has 2 parts. It has the outer epidermis. And remember, epidermis is an epithelium. So it's an epithelial tissue, remember from our tissue thing. And what kind of tissue is it? Stratified squamous, yeah, stratified squamous. Remember, you name it by the cells on the top. And then the dermis, which is underneath the epidermis, is all the connective tissues and all the supporting tissues that support that epidermis, which is on the outside. The accessory structures that I just mentioned, hair, nails, and multicellular exocrine glands. That's things like mammary glands, that's things like sweat glands, so forth. The subcutaneous tissue is the stuff that's under the skin. Remember that the epidermis is really thin. I mean, even though it's like 20 layers of skin thick, skin cells thick, that's still pretty thin. So when you lift your skin up like that, you're grabbing a whole bunch of this loose connective tissue and so forth. And so indeed, the hypodermis is what we're talking about here. This is the subcutaneous, clearly below that layer. It's where hypodermic injections go when you get a shot. It's below the dermis. Hypodermic, get it? The one thing that's nice about the skin is really we only have one microscope slide of it. Well, I'll take that back. We have two at least, thin skin and thick skin. But this is kind of a composite diagram here of the whole business. And the important thing that you know is that the epidermis, which is the stratified squamous epithelium, only goes from this blue line up. So these are all the basal cells or skin cells that are on the basal levels. And then they come up, and the top layer up here, which we'll talk about more, are the cells as they're dying and flipping off. You know, inside in the hair, you know, here's a hair follicle. You guys have all pulled out a single hair, and you get the follicle out with it. You're pulling out this whole tip down here, which is where the hair grows from. There's a number of kinds of nerve fibers that come up through here that measure temperature and measure pressure, measure pain, and so forth. We'll talk about those different things. And then down here deep, here's a sweat gland right here. This is a little muscle right here called the arrector pili. That's A-R-R-E-C-T-O-R. And basically, these are the little muscles that make your hair stand up on end and give you goosebumps. Now, my cat we let her outside, and she'll be sitting outside on the back porch in the winter, and you look at her, and she's all puffed up, and all of her hairs are standing on end. And that's what the arrector pili muscles really do. We just don't have enough hair to make that work much for us humans. But for like the cat, it makes all of their hair stand up on end. It gives them all that additional insulation because between all those hairs, it traps air in there, which is like having a down jacket on, basically. It also makes them look bigger, so that if there was a little dog that wanted to kill them, they might look big enough that the little dog would think twice about it. You know, it's just kind of a size thing. So that's the arrector pili, and every hair that we have has gotten one of those. It's what kind of muscle do you think that is? Remember, we have three kinds of muscle. Which kind do you think that one is? Smooth, did I hear? Yeah, it's smooth muscle. Is it under our control? Can you give yourself goosebumps? No. And it's certainly not cardiac muscle, is it? So yeah, it's smooth muscle. Arteries and veins are all down here deep. Notice there are no arteries or veins up here above the epidermis, above the blue, the lowest blue cells there. And that's what I think I talked to you about, the paper cut. You can cut your skin and it won't bleed unless you go all the way. If you go through the epidermis, though, completely and get down into this stuff here, it's going to bleed because there's blood vessels down there. But there are no blood vessels in that epidermis. So the only way these cells up in here in the skin get nourished is by blood from these little vessels down here underneath it, give off the oxygen and the sugar, and then it diffuses through the interstitial fluids, the fluid that's around the cells, to get up to those upper layer cells. Fat down here. Okay, so what are the functions of skin? You probably ought to know this. It protects us. It's the biggest protector we've got. It keeps the bad stuff out. It lets the good stuff in. Actually, we don't get much stuff in through our skin. But it protects us from bacteria, from viruses. Most things can't get through our skin unless our skin's got a cut in it or something. We also excrete salt and water. For example, if we sweat, we can pour out tons of water and tons of salt Now, I don't know if you've licked your sweat lately, but it's usually pretty salty. That's a way our body has of getting rid of extra salt and water. It maintains our body temperature. Not only does it insulate us from the cold, but when we sweat, it evaporates and that cools us down. It synthesizes vitamin D. We're going to talk about vitamin D a little bit before we get through this. It also serves to store lipids. It stores fat. A lot of fat is stored in our skin. I used to operate on folks and do obesity surgery. It was not unusual to have to cut through that much fat before you got down to the first layer of fascia, or the first layer of muscles. We came up with a pretty cool way to do that, actually. We just make a little incision right through the skin, and then one guy on one side and one guy on the other side would just pull it apart. And the nice thing about that was it would always come apart right in the midline. It gets you right down to the middle, which is right where you want it to be, and to go through the linea alba between the two rectus abdominis muscles and get inside the belly. Yeah, I've seen lots and lots of lipids stored in the skin. And then obviously our skin is our biggest way of communicating with the outside world. It detects touch and pressure and pain and temperature and all that stuff. The epidermis, remember now, epidermis is the epithelium, and it is avascular, has no blood vessels. It is stratified squamous epithelium. The nutrients and ion and oxygen diffuse up from the capillaries that are in the dermis. There is no blood supply in the epithelium or in the epidermis. The epidermis has a lot of these little ridges like this, and they're called dermal papillae. And the reason for that is it creates more surface area. So there's more area for things to diffuse through to get up into these tissues. These are called epidermal ridges, as you can see up here. And if you can't peel it apart like that. That's just a schematic drawing there. But if you could, that's the way it would look. If you look at your fingers and you look, you have these things called fingerprints, these little ridges, and those little ridges actually are showing you the pattern of the epidermal papillae underneath that. The other thing about those, just so you know, and I think we come back to this in a minute, is that the sweat glands are usually located at the top of that. So that's why you leave fingerprints, because your hand makes oil and sweat, and when you touch something, those sweat glands and little oil glands come from the ridges, and that's what creates fingerprints. Keratinocytes are the names of the cells that are on the top up there. They're called keratinocytes for only one reason. That's because they have a lot of keratin in it. Keratin is this protein that is kind of leathery and dry. And that's why our skin is dry. It's not moist like all the other mucous membranes on the inside of us. Thin skin, we only have two kinds of skin, thin skin and thick skin. It's easy to really remember, because just remember, thick skin is only found on the palms of your hands and the soles of your feet. The thick skin has 5 layers of keratinocytes. Thin skin only has 4. Now, just don't get confused by this, because even though thick skin has one more layer, the reason thick skin is thick is because the upper layers are really thick. It's not because of that 5th layer. That 5th layer is just a little line of maybe 1 or 2 cells. I'll show you in a minute on a microscope slide. But just remember that and keep that in mind. So this is thin skin over here. Notice that the one way to tell it is that the stratum corneum is up here and it's thin. Duh. Okay, so this is the part you can see the corneum that's going to be falling off and flicks off from time to time and makes the ring around your bathtub and all that jazz. The thick skin over here, like on the bottom of your foot, you notice the stratum corneum is extremely thick, and it doesn't take a rocket science to look at the bottom of your foot or look at your palm here and realize that the skin is a lot thicker, especially if it's calloused. Then this gets really thick. This is the fifth layer, and I got better pictures in just a minute, but it's the stratum lucidum. It's the lucid layer, which means it's kind of clear. It's kind of a clear layer. You can see it right here. But you see, even though that's the fifth layer, that is not the layer that made the skin thick. That makes sense? The layer that made it thick is this one up here, stratum corneum. All right. There's 5 layers to the epidermis in thick skin. And we're going to go over them from bottom to top, okay? The skin grows upward. In other words, all the new skin cells are formed at the base. And we call that lowest layer either the stratum basale or the stratum germinativum. In other words, this is where the cells germinate from. It makes new cells. Sprouts, new cells, germinate, right? Up from that, the next layer up is called the stratum spinosum. Now, I'm going to describe them to you as we go, but it's better with it when I have a picture up here in just a second. The stratum spinosum is called that because the cells start to look kind of spiny. And the reason they look kind of spiny is they're losing some of their cytoplasm, and the fibers inside it start to stand out a little bit more. Then there's the stratum lucidum, that clear area that is only found in thick skin. And then comes the stratum corneum, the one on top. And it's the corny layer, the horny layer, the hornified layer, the cornified layer, whatever you want to call it. It's the one that flakes off all the time. Somebody came up with this. I think that's really stupid. Cora Lucille's granny spins baseballs. What? It stands for, CLGSB. Okay. I got a few that are pretty good, but that one's not, I don't think. So here's a nice close-up view of this that maybe will help and make it look more clear to you. You will find some really good slides over in the boxes over in the lab that you should look at. These are the little papillae. This is the dermis down here. So this layer right here is what we would call the basement membrane. Remember from our studies, from talking about the different layers, this is the dividing line between epidermis, which is above, and the dermis, which is below. We call these bulges like this the papillary dermis, the little papillae of dermis. Got it? All right, so here's the stratum germinativum right down here at the bottom, and if you look carefully on most of these slides, you'll see a whole lot of mitoses going on. You'll see metaphases with all the chromosomes lined up in the middle and in different phases of mitosis when you look at these cells right along here. Next layer up is called the stratum spinosum, and you get the feeling there that there's some space, almost a little space between the cells as some of the cytoplasm kind of melts away and the little fibers become a little more obvious. Then the next layer is the stratum granulosum. It's called the granular layer, and what are those granules made of? Granulosum, granules of something, right? What would that be? Melanin, yeah. So if you were to look at, and we have slides over in the lab, I believe, that are Caucasian and Negro skin, and the only difference between the skin, it's exactly the same, except this layer right here is a good bit darker. That's where the melanocytes are, and that's the whole difference in light skin and dark skin, and every skin in between. Don't want to leave anybody out, right? Okay. So, granulosum, then the lucidum, which is this clear area, and look at that. You can't really see it hardly. I mean, it's this layer right there that's not very clear, and it's not very obvious, is it? then the stratum corneum, which is, these are all the cells. By the time they get up to here, they have lots of keratin in them. By the time they get up to here, the cells are basically are dead, and they're just full of keratin, but that is what gives us the dry, leathery format to our skin. Now it's going to go through them one by one on the slideshow here, but I think I've pretty well said most of this. Germinated layers on the bottom, these little epidermal ridges that I've talked to you all already about are fingerprints, and then the dermal papillae are these little mounds. Here's a question for you. How many of you guys were alive for the O.J. Simpson trial? You remember that? There was a new test on the market back in the days of O.J. Simpson, and it was called DNA. You guys remember that? It had never been used in court before. And so they spent at least a month and a half bringing in all these experts to say, oh, DNA, it absolutely tells you who this blood came from. If the DNA matches, it's a match. Well, now, sir, are you sure it's a match? What are the odds that it's not a match? And they would say, well, it's 1 out of 6.4 billion. Well, wait a minute, sir, there's only 4 billion people on the planet. So does that mean it's pretty well identifies the person? Well, I can't say that. I can only say that the odds are 1 out of 1.6 billion that it's somebody else. This went on for weeks on end. And why do I bring that up? Well, I bring that up because now, let's flash forward 15 years, 20 years, 25 years almost. You guys watch CSI, right? If you've got the DNA, you've got the guy. There is no question. Nobody's going to work their way around DNA evidence. Can we all believe that now? So I guess what I'm saying is that it took basically 20 years for DNA to be accepted in the courtroom as absolute evidence of who somebody was. How about fingerprints? Fingerprints are pretty good. I mean, you know, other than identical twins, everybody's got different fingerprints. In fact, I think even identical twins have different fingerprints sometimes, don't they? And how long do you think that took to get accepted in the courtrooms? About 40 years. You know, J. Edgar Hoover and the boys at the FBI started collecting cards with fingerprints on it, and they could only scan them with a magnifying glass and look at them, you know, and come up with all of these ways to try to help identify them. But it took about 40 years before fingerprint evidence was acceptable in a court trial. Well, that's the way it works in our country. You know, it just takes time for some of these new technologies to work their way in the courtroom. But this is the basis of fingerprints right here, is these epidermal ridges. There you go. See how the little pores to the sweat glands come out right on the top of all the ridges? That's why when you put your finger on something, that it leaves a pattern, and it's the pattern of those sweat glands is really what you're leaving a pattern of. Some cells we have that are special that you need to know about are Merkel cells. Merkel cells are really only found in hairless skin. They respond to touch. What's hairless skin? You know, I think there's some here around your eye a little bit. Not too much. I guess on your palms, you don't generally have hair either. Melanocytes are the cells that contain the pigment melanin, and they're scattered every so often throughout the stratum germinativum. Not every cell is a melanocyte. In some skin, there's more than others. But it's not really the number of melanocytes that make the difference, it's the amount of melanin that they make. The spiny layer, that's stratum spinosum, is the next one. It's about 8 or 10 layers held together. The cells tend to shrink until their cytoplasms stick out. That's what really makes them look spiny, is the cytoskeleton of the cell itself. There's some that continue to divide at this level, and this is an important point here. The cells of the stratum spinosum contains dendritic cells. Dendritic cells. When I say dendrite, what do you think? You think what? Nerve cells, right? Dendrites are the little branches that carry the signal into the nerve cell, and then it's the axon that carries it out, right? But these are called dendritic cells, so you'd think they'd be related to the nervous system. They're not related to the nervous system in any way. What they're related to is the immune cells. And when we get to the immunity and we talk about getting the common cold, and the body kind of goes looking for the dendritic cells around the body, that's where these really come in. These dendritic cells are what gives you long-term immunity to some things, like the flu. Stratum spinosum is starting to get grainy because of lots of keratin is being made, keratohyalin. Stratum lucidum is that clear layer, covers the stratum granulosum, corneum, horny layer on top. We pretty much resist, and we pretty much shed all of our skin every 2 weeks. The stratum corneum is very water resistant. Water still can diffuse through our skin, right? Even though it's water resistant, it's not waterproof. How do you know that? How many of you have been in a hot tub lately and stayed in there for a couple hours, or say even an hour? What happens to your hands? They get all wrinkly, right? Why do they get wrinkly? Water that's diffusing into your skin and filling those skin cells up with water. Why? Because,
Cells want to have equal balance with outside.
yeah, and that's homeostasis, yeah, but what do we call that process that makes that water go in?
Osmosis?
How about osmosis? Yeah. Where and osmosis means that water is going from the area of highest concentration to the area of lowest concentration. So, is the water more concentrated in the hot tub, or is it more concentrated in your finger? Water is more concentrated in the hot tub because it's pure water, pretty much. Maybe a little bit of chlorine, but that's it. So that water is trying to get in. Right? Now, the $64,000 question. How many of you have a saltwater hot tub? How many of you have been swimming in a saltwater pool? What's the difference? You don't get the swollen fingers, right? Because now you've got salty water on the outside, salty water on the inside, basically, and it doesn't do that. Is it really better? I don't like it. Salty water tastes salty. All right. That make sense?
You would float.
Yes. You do. You float more in salt water. My story on that is when I was a kid, I think I was about 15 years old, and we were driving across the country. Dad was in the Navy, and we traveled all over the country a bunch of times. And one day, Mom and Dad said, hey, we're in Salt Lake City. Let's go check out the lake. Let's all go swimming. And we did. And they had beaches marked off. Woo, man. I could float with my nipples out of the water. I mean, normally I float with my nose and maybe my lips out of the water, but in this Great Salt Lake, I was up that much more. Why? Because the water's so salty and it's so concentrated that it gives you more buoyancy. And you float up and out of the water. Now I will tell you, take my word for it, and don't go swim in Great Salt Lake. It is so salty, it burns your skin almost, and you have to get out. Luckily, they have little shower hoses around so you can hose off, because in 10 minutes, you're stinging. It's that salty. It's like the Dead Sea. That's over in the Holy Land, Jordan. Jordan and Israel. Okay. I think I've said it. Let's talk for a minute about sweat. And let's just say that we have two major kinds of sweat. One is what's called insensible perspiration. Now, all of you right now are insensibly perspiring. In other words, if I can borrow your arm here, I know he's perspiring through this arm, but I don't see any water on it. It doesn't feel wet or anything like that. But what is really insensible perspiration? Well, it's really just water near the surface evaporating, and so it never appears as water. But you are losing water through your skin all the time. Okay? And that's the same mechanism of water coming in when we get our hands get wrinkly, right? It's just the opposite of that. There are no glands that secrete that. That is water that diffuses directly through the cells of the stratum corneum. How much is it a day? 200 to 300 cc's a day. And you may say, well, how do you calculate that? Well, you really don't. You just know that when you add up all the input, like if somebody's in the ICU and you're measuring how much fluid came into them, drop by drop through IVs and so forth, and then you measure how much is going out, you're measuring every drop of urine they make, and so forth. Assuming they don't have a high fever and they aren't actively sweating, you've just got to account for that. You know that they're losing insensible perspiration all the time. So when we get to fluids and electrolytes, we will add that in every day. Everybody's losing it, whether you want to or not. Sensible perspiration is the stuff you can actually see and feels wet, and this is actually water that is secreted by the gallon sometimes by sweat glands. Dehydration can result from damage to the stratum corneum. I think I already mentioned burns and blisters. Burns and blisters remove the stratum corneum, and you don't have that leathery coating to your skin anymore, and so water is just pouring off of you. We had a formula that we used when somebody came in with, say, a 60% burn, and we were giving people 4 cc's per kilogram per hour. So if you had per percent. So if they were 60% burned, times 4 times their kilograms, which say an average person's 70 kilograms, it's like 1.5 liters an hour, something like that. I don't know. So you are literally pouring water into them and pouring saline into them as fast as it will flow through big IVs, just to keep up with the water that they're losing through their skin. And if you don't do that, they'll get dehydrated, go into shock, and die on you because they don't have the protection of their skin anymore, and they're losing lots of water. So burns are terrible injuries. You can also get dehydrated from being put in a hypertonic solution. In other words, the really salty water, hypertonic, right? Hyper, really high tonicity, like seawater. Why is it that if you're out on the ocean and you're in a life raft, that you don't want to drink seawater? What? You'll get dehydrated. Wait a minute, you're drinking water. How can that make you dehydrated? Think on it. Hydration results from immersion in hypotonic solution. That's the hot tub that I talked about. That's where water comes into you. That's fresh water. Causes the swelling of the epithelial cells. It really just causes wrinkly fingers. But obviously, if it keeps up, it can get a lot of water into your body like that. Skin color, let's talk about it. It's influenced by several things. 2 pigments. Basically, one is carotene. Carotene is this orange-yellow pigment. It's found in Carrots, amazing. Carrots, get it? Carotene. Man, doesn't get any better than that. And what did your mother always tell you about eating your carrots? You needed your vitamin A so that you could see better, right? Vitamin A is important in the eye. And when we start learning about the eye and the cells and the chemical reactions that allow you to see, we'll come back to this and talk about vitamin A some more then too. Melanin is the other pigment. Melanin is the yellow, brown, or black pigment. It's produced by these melanocytes that we talked about earlier that are found in the stratum germinativum. And they package it up. They package this dark dye up into little things called melanosomes, and then they pass them out. They pass them out to different keratinocytes. So that's what makes the skin darker colored and any flavor in between. Now, that's not the only things that changes the color of your skin. I always like to do this because if I squeeze my hand, you'll notice that my hand is pretty white and then it pinks back up. You see that, Anita? Y'all see that in the back? So, what's accounting for the color of my skin there? Blood flow, yeah. So we have capillary blood flow that in a nice warm room like this, my hands are nice and red. If it was really cold in here, just sitting here without me squeezing my hands would be white. Why would they be white?
Maintain a lighter.
It takes away from your extremities.
Yeah, they would want, my hand would not want blood flowing to it because when that blood flows past here, it gives off the heat and I lose body temperature. So you don't want blood flowing right up next to your skin, in your face as well. Here's melanocytes. Here's the stratum germinativum, the bottom layer. The basal lamina is the layer below, and this is called the stratum basale or the stratum germinativum, right? And you notice that these are cells that are making the melanin. That's the difference. That's the difference in the races right there, is that one layer of cells. Kind of makes us look stupid, doesn't it? Make a big deal out of it. This is a diagram of a melanocyte. So here's the melanocyte. It's this, not every cell down there is a melanocyte, obviously. These are all skin cells here. But this one is a melanocyte, so it's manufacturing all these little melanosomes. And then as you go up here, you see it passes them out. So here's a cell that's picked up some melanosomes from the melanocytes to make the skin darker. They're a little darker there as well. Let's talk about skin cancers for a minute. This is a basal cell carcinoma. These occur a lot on the face. These are very much related to sunshine. A lot of old guys will have basal cells. And they just need to be removed. They almost never ever kill anybody. They can get really big, and you just got to take them all off. And you'll see guys once in a while that had a big flap rolled up there on their face or something. It's probably a basal cell carcinoma because they can get really big, and people tend not to come in. They don't hurt or anything, and they don't want to come to the doctor, so they don't. This is a melanoma. This is the bad boy. This is the bad actor. Melanomas are really dark. They've got a lot of them made from melanocytes that become malignant. They get really dark like that, and they kill you. Melanomas spread around your body and kill folks. The problem is, and this is my problem with this skin lotion stuff, skin sunblock, is that melanomas, since this is the only one that really kills you, you would think that if it was related to sun, where on the body do you think you'd see more melanomas? On your face, on your forearms, on your hands, things that are in the sun, right? There's no relationship whatsoever. Melanocytes are found just as often between your toes, on the bottom of your foot, in your crotch, places that don't get a whole lot of sun. So in my book, While these other forms of skin cancer, which we call cancer, but yet they never kill anybody, they are related to sun. This one's not. There's lots of studies on that, and they're kind of off and on. Melanoma is a scary one, though. We'll come back to it a little bit more. I'm going to talk for another minute or so, then we'll go. So what are melanocytes for? Why do we have dark skin? Why do some folks have dark skin? You have it to protect yourself from ultraviolet light. And so if you stay out in the sun and tan a lot, you can actually stand more sun, which is protective of you, because we know that ultraviolet light can cause DNA mutations and burns and things that can lead to cancer, and also that really scary thing called wrinkles, which women hate more than anything, more than cancer for sure. And just remember that the skin color depends on the amount of melanin produced. It does not depend on the number of melanocytes. So some people can have just a few melanocytes, but it's working like crazy, making lots of melanin. And I think we'll stop right there on capillaries and skin color. Okay? Questions? Okay, we'll start up in lab in 30 minutes or so. You'll have a nice lunch. Smoke them if you got them.